खाना कच्चा ना छोड़े, अच्छे से पकाएं।
चेक चेक चेक।
खाना पकने के बाद उसे हमेशा थोड़ा ठंडा कर लें और खाने को बर्तन में रखें। साथ ही खाने को हमेशा ढक के रखें। पके हुए खाने को अगर आपने अगले 2 घंटे में नहीं खाया है तो उसे फ्रिज में डाल दें, स्पेशली गर्मियों में। खाना हमेशा 5 डिग्री या उसके नीचे स्टोर करें। फ्रिज को हमेशा 5 डिग्री के नीचे रखें। हमेशा ध्यान रखें कि पका खाना और कच्चा खाना अलग अलग जगह में रखें, फ्रिज में भी।
Smoking is harmful for health. It will damage my lungs, which will eventually decrease my lifespan.
It's harmful for my body and my lungs.
Vaping is nothing better than smoking. They both harm us equally because vaping is just flavorized smoke.
Both have health concerns and can be addictive and have negative health effects.
When we talk about the youth, they certainly feel that e-cigarettes and vapes, etc., are a form of show-off, and they do not realize the harmful effects. In fact, at their age, it would have a more harmful effect. Tobacco is not only harmful for yourself, but also those around you. I myself know because one of the members in my family has fallen a victim to cancer, which was caused due to smoking. Say no to tobacco.
These hands have created beauty. People used to say that these fingers could do magic. Then one day, these fingers just stopped working. I noticed a patch on my arm. My fingers started getting weaker. Then I went to the doctor.
If you find a numb patch on your body, immediately consult a doctor. It may be a symptom of leprosy. But don't you worry, leprosy can be cured. Examine yourself, know the symptoms, end leprosy.
Excellencies, distinguished delegates, ladies and gentlemen, very good morning to you. Welcome to the third and final day of the 78th session of the WHO Regional Committee for Southeast Asia. I noticed that the morning physical activity session was a great hit, and the delegates and the WHO SEER office wholeheartedly participated. On behalf of all member states, I thank the organizers and especially the police department for arranging the wonderful session. The next item on our agenda is item number 9, progress reports on selected regional committee resolutions. This agenda item brings to you progress reports on 9 selected resolutions and decisions adopted by the past sessions of the regional committee. As the practice, we will now be discussing all of these together. These progress reports have been extensively discussed at the HLP meeting. In this regard, I draw your attention to the working papers SCO/RC 78/10. The HLP recommendations made under each progress report are provided in Addendum 1, and copies of all related resolutions and decisions are presented in the Addendum 2. A copy each of the detailed reports in draft text on progress of resolutions on CHARTs, accelerating prevention and control of cardiovascular diseases in the WHO SCA's Asia region, that is SCA/RC 76/R5, and promoting physical activity in the WHO SCA Asia region, SCA/RC 69/R4, are presented to the session of Addendum 3 and Addendum 4 respectively. Are there any further comments or observations on any of these items? In view of the fact that we are taking up all 7 sub-items together, member states have 5 minutes each for their intervention. Thank you, distinguished delegates. I now invite Dr. Manisha Sharma. Oh, sir, it's India. I now invite India to start the interventions.
Good morning, Excellencies, distinguished delegates, colleagues and partners. Thank you, Chair. India take note of the progress reports on selected regional committee resolutions. Chair, at the 80th session of the UNGA, India's National Heat Action Plans, innovative use of digital tools for last mile alerts and promotion of low-cost cooling solutions were widely appreciated as exemplary approaches to addressing the challenge of extreme heat. India is implementing actions envisioned under the Mali Declaration. India reaffirms its commitment to the regional plan of action. Chair, the Government of India has launched the 75/25 initiative, intending to place 75 million individuals with hypertension and diabetes on standardized treatment by December 2025, implemented through Ayushman Arogya Mandis under primary health care. As of 1st of August 2025, 76.1 million patients are receiving standard care. Chair, the elimination of measles and rubella remains a global public health priority, and India has taken sustained and proactive measures to achieve this goal. In the year 2024, MR1 and MR2 coverage stand at 97.8% and 93.3% respectively. Government of India has launched the Zero Measles Rubella Elimination Campaign in April this year, aiming to eliminate measles and rubella cases from every district with special targeted drives undertaking extensive IEC activities with the commitment to achieve zero measles rubella. In the month of September 2025, Honorable Prime Minister of India launched the campaign Swasth Nari Sashakt Parivar Abhiyan for strengthening healthcare, vaccination, and nutrition services for women, adolescent girls, and children across India. Chair, India's commitment to strengthening school health programs is reflected in the implementation of the School Health and Wellness Program, which adopts a comprehensive approach to physical and mental well-being of the children. Emotional and behavioral concerns, including depression, anxiety, self-harm tendencies, aggressiveness, and internet addiction, are identified through the proactive efforts of school teachers, ensuring early detection, support, and referral for timely intervention. Chair, India has significantly expanded the civil registration system by making it more citizen-centric, digital, and inclusive. A landmark reform now mandates the birth certificate as the sole document for establishing the date and place of birth for children born on or after 1st of October 2023, with registration centers set up in all health facilities. The newly launched CRS mobile app enables citizens to register births and deaths seamlessly in any official languages and receive electronic certificates. As a result of these measures, birth registration coverage of India has increased to 96.5% and the death registration to 92.2%. Chair, prevention remains at the core of India's strategy with a strong focus on promoting healthy behaviors and reducing risk factors. The Government of India has integrated physical activity promotion into its comprehensive primary healthcare delivery through the Ayushman Arogya Mandirs, health and wellness centers. Our national campaigns, such as Fit India Movement and the Khelo India scheme, Play India, are fostering a culture of fitness and sports. In his address to the United Nations in 2014, our Honorable Prime Minister, Shri Narendra Modi, proposed the observance of International Day of Yoga. The proposal received unanimous support from the member states, following which the United Nations proclaimed 21st June as International Day of Yoga to be celebrated annually across the world. Chair, India appreciates and recognizes the value of platforms such as the IHR Knowledge Network and the Regional Working Group on Emergency Medical Teams, which foster solidarity and peer learning in the region. In line with the Delhi Declaration on Emergency Preparedness in the Southeast Asia region, India calls for greater investment in multi-sectoral platforms that address zoonotic diseases, AMR, food safety, and other shared risks at the human-animal environment interface. Chair, the Delhi Declaration on UHC also focuses on strengthening quality, comprehensive primary health care through a holistic approach with people and communities at its center. The Ayushman Arogya Mandir, operating through our 178,000 facilities, deliver 12 comprehensive healthcare services, including care for non-communicable diseases, mental health, palliative, geriatric, and rehabilitative services, emergency care, and provision for free drugs and diagnostic. The Pradhan Mantri Jan Arogya Yojana offers annual health coverage of $6,000 per family to the bottom 40% of India's population and has extended services to all senior citizens aged 70 and above, regardless of income, to support healthy aging and reduce healthcare disparities. India reaffirms its commitment to regional solidarity and looks forward to translating the declarations into measurable and tangible outcomes. Thank you very much.
Thank you, Mr. Pushpendra Rajput. Now I'll give the floor to Maldives, followed up by Nepal.
Thank you, Chair. Maldives appreciates the Secretariat's leadership and aligns with the collective voice of Member States on climate-resilient health systems, cardiovascular disease prevention, and civil registration and vital statistics. As a small island developing state, the Maldives face compounded challenges: geographic dispersion, limited resources, and fragile infrastructure, highly susceptible to the adverse effects of climate change. We are committed to building resilient, inclusive, and sustainable health systems. On climate resilience, we support the extension of the framework for action. In the Maldives, we are implementing green climate smart healthcare, waste management, and wash policies in health facilities. Donor-supported projects are strengthening pandemic preparedness, digital surveillance, and community resilience. We underscore the need for sustained technical support and funding to accelerate progress. Regarding cardiovascular diseases, we commend the Save Hearts initiative and support its extension to 2030. We recognize regional achievements in protocol-based management of hypertension and diabetes, salt reduction, and trans fat elimination. To overcome the continuing challenges we face, we are focusing our efforts on following critical areas. 1. Strengthening of digital health and integrated electronic records for reliable surveillance of hypertension and diabetes. 2. Sustained capacity building of frontline health professionals across all inhabited islands. And 3. Reinforcing policy and regulatory frameworks to address modifiable risk factors, particularly tobacco use, salt intake, and trans fat consumption. Regional collaboration and sharing of best practices will be indispensable in advancing these interventions. On CRVS, we reaffirm the civil registration is a fundamental right and central to universal health coverage and governance. Through our participation in the Third Ministerial Conference and endorsement of the Ministerial Declaration, we join Member States in reaffirming our shared vision that every life is counted, every death and every cause of death is registered with dignity and accuracy. Looking ahead, Maldives fully supports the extension of the regional CRVS strategy mandate to 2030. We acknowledge WHO's vital role in supporting member states with the transition to ICD-11 and improving cause of death certification. Our focus now is strengthening interoperability, building digital capacity, and advancing legal safeguards under the upcoming Digital ID and Data Protection Act. Continued collaboration and support from member states and partners will be crucial as we work towards a secure, inclusive, and fully integrated CRVS system. Thank you.
Thank you. And now I invite Nepal for the intervention. Next will be Bhutan.
Thank you, Chair. Honorable Chair, Excellencies and distinguished delegates. On climate health. While Nepal contributes minimally to global greenhouse gas emissions, we are among the most climate vulnerable nations. We face floods, droughts, glacier lakes, outbursts, and climate-sensitive diseases. To respond, we are implementing the Health National Adaptation Plan 2023 to 2030, aligned with our NAP and NDC 3.0, with a net zero target by 2045. We are strengthening climate-resilient health systems through surveillance, financing, and multi-sectoral coordination, and we welcome WHO's SEA framework extension to 2027 for integrating adaptation indicator and workforce development. Turning to immunization. This remains central to our UHC and SDG agendas. In 2024, we vaccinated 6.3 million children under 15 years in a nationwide measles rubella campaign, achieving over 90% coverage. In August, WHO verified rubella elimination in Nepal, reflecting a decade of a strong policy and practice. Our next goal is measles elimination by 2026. Yet, fiscal constraints, porous borders, and reduced partner funding remain challenges. To sustain gains, we are developing a polio transition framework 2025 to 2030, and we urge continued partner support. On emergency preparedness and responses. Guided by the Delhi Declaration, Nepal has contextualized the WHO Hospital Safety Index, expanded community surveillance, and co-chairs the WHO SEA Working Group on Emergency Medical Teams. Our One Health strategy and provincial committees strengthen preparedness for zoonosis, AMR, and food safety. Civil military health preparedness workshops further ensure cohesive response during crisis. Now, turning now to school health. Children's well-being is central to national development. Through the school health and nutrition strategy, we are strengthening services and promoting healthy learning environments. A key innovation is the One School, One Nurse program pioneered in Bagmati province, which we are preparing to scale nationwide. On primary health care, the PHC is foundation for our health system and key achieving UHC. Nepal's UHC index has reached 54, driven by progress in REM, NCH, and infectious disease control. Initiatives like safety delivery incentives, one-stop crisis management centers, and PEN and PEN Plus. Expansion extended PHC at rural populations in difficult terrain and rapidly urbanizing communities present unique challenges. To address this, we have launched the PHC Policy Dialogue series in 2025 to reimagine performance-driven PHC, and we request WHO's enhanced technical support in this area. Chair, on NCDs and CVDs, cardiovascular disease. Cardiovascular diseases remain our leading killers. Under our multi-sectoral NCD action plan, we are addressing risk factors and have pledged to enroll 1.5 million people in CHERTS for protocol-based management of hypertension and diabetes by 2025, contributing to the regional goal of 100 million. And civil registration and digital health. Nepal is making significant strides. Birth registration coverage has increased to 74%, and 70% of deaths are now registered within 1 year. All registered data are centralized digitally with pilots on birth registration management and medical certification of cause of death underway, demonstrating our commitment to digital transformation and accurate health data systems. Chair, Nepal's journey to reflect resilience and reform anchored in PHC, strengthened by immunization, responsive to climate threats, and empowered through digital health. And finally, Nepal is honored to join Armenia, Morocco, and Sri Lanka as the co-sponsor of this important proposal. We recognize the urgent need to advance health equity for people living with hemophilia and other inherited bleeding disorders. Nepal reaffirms its commitment to strengthening access to diagnosis, treatment, and care in line with our shared goal of universal health coverage and the right to health for all. Thank you.
Thank you, Excellencies and distinguished delegates. Now, I would like to invite Bhutan for the intervention, followed by Sri Lanka.
Chair, distinguished delegates, very good morning. We take note of the progress report on the selected RC resolutions. Bhutan wishes to make our intervention on Agenda Item 9.2, CHERTS, and Agenda Item 9.5 on CRVS. CVD remains the leading cause of death in Bhutan, accounting for 28% of all mortality. Recent data from the National Health Survey shows that 4.5% of adults aged 15 to 69 reported a history of heart attack, chest pain, or stroke, while 5.3% of those aged 40 to 69 are at high risk within the next decade. Hypertension, affecting 30% of adults in Bhutan, is a key driver of this burden. The steady rise in predicted CVD risk among older adults from 1.8% in 2014 to 6.2% in 2023, within a decade, you can see the multiple percentage increase, underscores the urgency of scaling up prevention, continuity of care, and community awareness. In response, Bhutan is advancing its Service with Care and Compassion initiative, known as SCCI, adapted from and integrating with the WHO Pain Heart Intervention, delivering patient-centered care while systematically screening for and managing CVD risk factors. In this regard, last year in the 77 RC, Bhutan committed to place at least 50,000 people with diabetes and hypertension under protocol-based treatment by the end of 2025. Through targeted intervention nationwide, Bhutan is pleased to inform that the target has been successfully achieved. The support from WHO has been instrumental in our achievement and therefore much appreciated. Noting the importance of reinforcing our joint effort in reducing the burden from CVD, Bhutan is pleased to lead the resolution on this agenda item and will be placed before this August gathering today. Bhutan, therefore, in the spirit of our continued solidarity and that this region enjoys, call upon member states to consider the extension of the timeline of the 4 regional milestones of the Sea Hearts initiative for another 5 years until 2030. In terms of CRBS, Bhutan's civil registration has evolved from a manual paper-based system to a digital web-based platform in less than a decade. Digital transformation has been central to our progress. The Integrated Citizen Services, known as ICS platform, powered by the National Digital Identity, NDI, enables smartphone-based registration of births and deaths, improving access to services, benefiting even the most remote communities. Particularly, the integration of birth and death registration into the ICS in 2023 enables citizens to register births, deaths, and marriages easily from their smartphones or computers, reducing administrative hurdles and greatly improving access to CRBS services. Bhutan is pleased to report that even during times of emergency, such as the COVID-19 that we all faced, its CRBS system remained accessible. In fact, it served as a crucial data source to plan delivery of various public services, including the national COVID-19 vaccination. While reaffirming our commitment to continue investing in resilient and people-centered CRBS system, Bhutan strongly recommends the member states to tap the potential of digital solutions and platforms as a means to achieving a resilient and inclusive CRBS system. The multi-sectoral national strategic plan for CRBS provides a clear roadmap in Bhutan for reform and investment. In the health sector, Bhutan is at the forefront in fully transitioning to ICD-11 through the rollout of our electronic patient information system known as EPIS. This system captures an individual's health data from birth to death, enhancing the accuracy and timeliness of vital events reporting. We are now initiating efforts to adapt and develop ICD-11 for our traditional medicine known as the Sowa Rigpa. We have recently launched the annual Household Health Surveillance, AHS, as a strategic initiative to strengthen primary health care and improve the quality of vital statistics, specifically to accelerate our effort to cover every birth and death. Bhutan now wishes to initiate verbal autopsy by June 2026 and integrating medical certification of cause of death in our electronic patient information system, and therefore looks forward to continued support from WHO. In our efforts, though small, aims to contribute to get everyone in the picture and ensure a successful journey to realizing the Agenda 2030. In solidarity, Bhutan endorsed the proposal to extend the CRBS decade to 2030 this year in Bangkok. With CRBS data underpinning more than 1/3 of the SDG indicators, we call on the regional member states to continue our efforts to realize our shared vision of universal and responsive CRBS system, critical of which is to strengthen health sector leadership and initiative in enhancing birth and death notification. Thank you, Chair.
Thank you, Mr. Penjo from Bhutan. Now I invite Dr. Asela Gunawardena, Director General of Health Services, on behalf of Sri Lankan delegation, followed by Democratic People's Republic of Korea.
Thank you, Chair. Distinguished delegates. Firstly, on Sea Hearts, Sri Lanka commends WHO for its guidance, which has enabled all countries in the region to initiate protocol-based management for hypertension and diabetes. In Sri Lanka, protocol-based management has been implemented in 6 out of 9 provinces, and we aim to achieve full national coverage within this year. Atorvastatin is included, and we plan to provide these medication in blister packs to enhance adherence and control. Effective control of hypertension and diabetes required more than protocol-based management. Challenges arise in secondary and tertiary care due to personal prescribing authority. Monitoring across all care levels is crucial, especially in Sri Lanka, where 50% access higher level services. To improve control, Sri Lanka advocates robust patient registration and follow-up system. Currently using a digital application, the country seeks to strengthen it and propose that WHO conduct clinical audit across the member state to ensure accurate protocol implementation and monitor effective hypertension and diabetes control. Secondly, on essential medical products, since 2018 Delhi Declaration, Sri Lanka has advanced access to essential medical products through strengthened
regulation by NMRA, enhance integrity mechanisms through rational procurement, and collaboration with WHO on medical device and diagnostic oversights. Despite economic challenges, Sri Lanka maintained free public access to medicine through WHO-assisted procurement and local production. However, supply delays, import dependency, and affordability issues persist. Future efforts will focus on improving procurement, expanding local production, enhancing regulatory harmonization through Southeast Asia Region Regulatory Network, and ensuring sustainable financing for equitable access by 2030. Thirdly, Sri Lanka has made significant progress in aligning with Delhi Declaration on Primary Health Care. The government has allocated $150 million USD for enhancing primary care services and proposed additional funding for Arogya centers under the new government initiative. Sri Lanka ensures resource efficiency and accountability through family doctor teams, multitask healthcare workers, community volunteers, and a life cycle approach covering preconception to elderly care. Sri Lanka invests on human resources, digital health, quality assurance, PHC monitoring, knowledge sharing with WHO, World Bank, and SEER PHC Forum. Thank you.
Thank you. Now I invite DPR Korea, followed by Bangladesh.
Thank you, Chair. We would like to deliver on Agenda Item 9.7, Delhi Declaration on Emergency Preparedness in Southeast Asia region. Approximately 1/4 of the global population is living in the Southeast Asia region, and the region has suffered acute human and economic loss due to frequent and various emergency outbreaks caused by natural disasters, communicable disease, and accidents. In the 72nd session of Regional Committee held in September 2019, the Delhi Declaration for Increasing the Investment on Emergency Preparedness has been adopted. Afterwards, the expansion of CRF corpus has been endorsed, and the way forward on expansion and utilization of the fund in the next biennium 2026-2027 has been discussed in details at the 14th meeting of CRF Working Group. The expansion of the investment and fund corpus for emergency preparedness and response is important. But what's more important is maximizing its effects by utilizing the fund in a cost-effective way. The adoption of the pandemic agreement in the 78th World Health Assembly in May has been a historical occasion for enabling global public health environment more desirable and equitable, and also safer in responding to the future pandemics. As in this agreement, since the emergency response capacity of WHO regions and member states are different from country to country, enabling regional diversification of health products and supply hubs of emergency supplies within WHO supply chain system is crucial. We regard that strengthening the emergency preparedness and response capacity of all member states evenly by transferring and sharing advanced techniques is in line with the Delhi Declaration, and we call all member states for close collaboration in this. DPR Korea is committed to contribute for the protection of lives and promotion of well-being of its people by accelerating the activities for being well prepared for various emergencies in close collaboration with WHO. Thank you.
Thank you, Mr. Chol. Now I invite delegation of Bangladesh, followed by Timor-Leste.
Honorable Chair, distinguished delegates and excellencies, regarding the health system resilience to climate change, the Bangladesh delegation welcomes and appreciates the agenda building health systems, resilience to climate change, and extension of the framework for action till 2027. The 6 building blocks of health systems under this framework is still very much valid. In alignment with the framework, Bangladesh has updated its Health National Adoption Plan and assessed carbon emission in 9 healthcare facilities for the first time. Going forward, Bangladesh is committed to prioritizing the following interventions: implementation of the HNAP, promotion of innovation and climate-resilient technology transfer, advancement of water sanitation and hygiene initiative, mobilization of climate financing. Bangladesh supports the extension of the framework for action on building health system resilience to climate change to 2027. Honorable Chair, cardiovascular disease remains the leading cause of death in Bangladesh, accounting for 34% of all deaths, of which 43% were prematurely. Major risk factors such as hypertension, diabetes, tobacco use, unhealthy diets, physical inactivity, and rising obesity continue to challenge our health system. Bangladesh has taken important steps to address this burden in line with the Share Hearts resolutions. At the primary healthcare level, we have adopted WHO plan-based chronic care model and scaled up screening, referral, and treatment for hypertension and diabetes. As of June 2025, nearly 600,000 patients are on treatment for hypertension and over 430,000 for diabetes in public facilities. Essential non-communicable disease medicine digital registers are being used to track patients, enhancing follow-up and continuity of care. A major milestone this year was the joint declaration of August 2025, signed by 35 ministries and divisions, reinforcing multi-sectoral action for NCD and mental health prevention. This builds on the National Multi-Sectoral Action Plan and reflects strong political commitment to tackling risk factors across sectors. Regarding measles and rubella, Excellencies, Bangladesh commends the Regional Director and WHO CRO for their continued leadership in advancing measles and rubella elimination in our region. We align ourselves with the regional strategy and reaffirm our commitment to achieving interruption of indigenous transmission by 2026. Significant progress has been achieved following 2020 nationwide MR campaign. Measles incidence fell to 1.4 per million and rubella incidence to 0.6 per million in 2024. Routine immunization coverage remains high. Surveillance indicators have exceeded regional benchmark and laboratory performance is robust. Bangladesh reaffirms its determination to achieve measles and rubella elimination by 2026 and contribute to healthier, safer Southeast Asia region. Mr. Chair, Bangladesh appreciates the Regional Director for the progress report and welcomes the regional momentum to revitalize school health program through comprehensive health promoting school models. Our country has initiated several steps in this direction. The Ministry of Health and Family Welfare, together with Director General of Health Services, is working closely with the Ministry of Education and the Ministry of Primary and Mass Education. A National Technical Committee has been formed with participation of WHO, UNESCO, UNICEF, and other partners. A draft National Health Promoting Schools Policy and Implementation Framework contextualized to Bangladesh and aligned with WHO global standards is under development. We have also launched a pilot program in 8 schools to integrate NCD prevention and mental health promotion into a holistic model. The Directorate of Secondary and Higher Education has begun training teachers, identifying HPS ambassadors, and running awareness campaigns. In September 2025, a joint declaration by 35 ministries and divisions committed to multi-sectoral action on NCDs and mental health, which will directly support scale-up of the HPS initiative. Recognizing the critical role of civil registration and vital statistics, recalling the commitments made under the Sustainable Development Goals, particularly Target 16.9 on providing legal identity for all, including birth registration, and recognizing the critical role of civil registration and vital statistics systems in advancing universal health coverage and evidence-based governance. Recognizing that complete, accurate, and timely registration of birth and death is indispensable for ensuring legal identity, protecting rights, and generating reliable data to inform health, education, and social protection policies. Concerned, however, about persistent challenges including fragmented reporting mechanism, limited interoperability between institutional database, inadequate human resource, under-reporting in hard-to-reach and marginalized communities, and the absence of comprehensive legal frameworks for interagency data sharing accountability. Urges member states to strengthen governance and coordination framework, enhance digital interoperability, review and update national legal and policy frameworks, invest in human resource, infrastructure, and ICT system, promote public awareness, strengthen national capacity, and empower the health sector. Request to the regional director to facilitate regional knowledge exchange, to provide technical support and capacity building, to coordinate with development partners and international agencies, to report periodically on progress in implementing this resolution to the WHO Regional Committee for Southeast Asia, synchronized with global and regional monitoring of SDG Target 16.9 and related initiative. Thank you, Chair.
Thank you, Professor Chaudhary. Now I invite the delegation of Timor-Leste, followed by Thailand.
Thank you, Chair. Distinguished delegates, ladies and gentlemen, guided by the vision of universal health coverage and aligned with the 9th constitutional government priorities, Timor-Leste continues to advance its public health agenda with resilience, partnership, and commitment to equity. For a small island nation like Timor-Leste, the climate change is a life reality. We are integrated climate and environment sustainability into the national health strategy, strengthening disease surveillance and ensuring the health infrastructure can withstand climate shocks. Ecosystem restoration of mangroves, reef, and forests remain central to our community resilience. Cardiovascular account 51% of all death. With WHO support, we are implementing the CHR techniques package, conducted the first NCD risk factor survey, and finalizing the national food law with a trans fat restriction. Hypertension and diabetes care are being scaled up with a new SOP, and stroke and palliative care under review. Timor-Leste eliminated measles in 2018 and rubella in 2023 through the strong immunization coverage. Upgrade the cold chain system and community outreach, demonstrating what sustained partnership can achieve. Our nationwide school-based primary healthcare package now reaches over 210,000 students across the 1,000 schools, with revitalized deworming and 11 model school health rooms established. Collaboration with the Ministry of Education ensures schools promote both learning and well-being. With 64 community gyms established and physical education integrated into school, we are promoting active lifestyle and banning unhealthy food in school settings. We are aligned with the regional strategic roadmap on health, integrated IHR capacity into national disaster governments, and strengthening our laboratory and genomic surveillance system. 75% of our 2026 health budget is earmarked for PHC revitalization to the community health volunteer program and expanding integrated primary healthcare services. With WHO support, we endorse the nation medicine policy and biomedical equipment policy, improving procurement, access, and reliability of essential medical products. Honorable Chair, Excellency, and Delegates, Timor-Leste progress reflects our deep commitment to value of equity, resilience, and partnership that define the WHO Southeast Asia region. From eliminating the disease to strengthening primary health care, from protecting ecosystem to combating NCDs, Timor-Leste staying determined to ensure that health for all become lived reality. We reaffirm our dedication to working hand in hand with WHO and our regional partners. We remain fully committed to all these resolutions to build resilient, strong, and more sustainable future for the people of today and the generation of tomorrow. Thank you.
Thank you. Then I invite delegation of Thailand to make their intervention.
Chair, distinguished delegates, Thailand commends the Secretariat for the comprehensive progress reports and appreciates the WHO's continued support to member states in advancing the implementation of regional resolutions that have strengthened health systems and accelerate progress towards sustainable development goals. First, on building health system resilient to climate change, Thailand strongly supports the extension of the regional framework to 2027. This will allow us to deepen implementation and strengthen knowledge sharing. In alignment with our National Health Adaptation Plan, we are upgrading our green and clean hospitals into climate resilient, low carbon healthcare facilities. We encourage the WHO to continue providing technical guidance to help member states operationalize these commitments. Turning to CHARTs, Thailand is on track to achieve our 2025 milestones and has already surpassed national goals for salt reduction and trans fat elimination. We are proud to be the first and only country in the region to receive WHO's validation certificate for trans fat elimination, and we are ready to share our experience. We fully endorse extending the CHART initiative to 2030 to sustain momentum in cardiovascular disease prevention. However, implementation challenges remain. Only about 187,000 public primary care facilities across the region are currently reporting the protocol-based management. Strengthening primary health care, ensuring reliable medicine supply, and expanding digital capacity are critical. While Thailand has achieved 100 electronic coverage, tracking patient control status remains a regional challenge. We therefore recommend investing in robust, interoperable digital health systems for long-term patient follow-up. On school health, Thailand continues to implement the global standards for health promoting schools through strong collaboration between the Ministry of Public Health and Education. We believe clear policy direction, committed leadership, and adequate resources are key to success. We also encourage continued regional knowledge exchange on sustainable management and financing models for school health programs. Regarding physical activity, Thailand remains concerned that only 1/4 of school-age children meet activity recommendations. We have developed a national plan aligned with the Global Action Plan on Physical Activity to promote active lifestyles. We call on the WHO to support regional implementation through clear targets, practical guidelines, and integrated initiatives, such as linking active transport with air pollution reduction. Finally, on Daily Declaration on Emergency Preparedness, Thailand reaffirms that resilient health systems are the foundation of effective response. We have strengthened surveillance networks and regularly conduct simulation exercises. To bolster regional health security, we urge 3 actions. First, continue development of IHR core capacities with peer review mechanisms like universal health and preparedness review. Second, strengthening multi-sectoral coordination and robust information systems. And third, mobilizing sustainable domestic financing to close preparedness gaps. Chair, Thailand appreciates the WHO leadership and the collective efforts of member states reflected in these reports. The progress achieved across our region is a testament to our shared commitment, solidarity, and determination to translate resolutions into real impact for our people. Thailand will continue working closely with WHO and fellow member states to advance universal health coverage, promote healthy and active communities, and build a region that healthier, stronger, and more resilient for all. Thank you.
Thank you. All 9 member states have made their interventions and they are very descriptive and informative, and it is a real opportunity to all the countries to share their experiences and reshape their health systems and to achieve their goals. Thank you, distinguished delegates. I now invite Dr. Manisha Sharma from Drugs for Neglected Diseases Initiative to deliver a statement on their behalf on Agenda 9.1.
Thank you, Chair. DNDi welcomes the progress report and appreciates the focus on climate-sensitive diseases such as dengue and Kala-Azar in the framework. Climate change-induced mortality and morbidity from vector-borne diseases are expected to rise in the future. For many climate-sensitive infectious diseases, current tests and treatments, when they exist at all, have limitations that hamper the provision of life-saving medical care and impede disease control and elimination efforts. For example, no specific treatment for dengue exists, and at this stage, with more frequent outbreaks, prevention measures such as vaccination or vector control programs alone will not be sufficient to address dengue infections. The development of therapeutics tools to prevent disease progression and reduce hospitalization must become a core element of climate adaptation strategy, not only saving lives, but also protecting the functional of health systems. Innovation is an essential pillar to climate adaptation in the health sector. The development of patient-friendly, safe and effective medicines, particularly those tailored to the needs of vulnerable population and adapted to the primary care, strengthens the capacity of health systems to anticipate and respond to the growing burden of climate-sensitive diseases. In some cases, they are also essential to achieving disease control and elimination goals. The Global Action Plan on Climate Change and Health induced commitment to detect, prevent, test, and treat climate-sensitive diseases. We urge member states to operationalize the commitments by supporting and development of a list of climate-sensitive diseases, promoting research on the links between climate change and vector-borne infectious diseases, investing in R&D for new tools to tackle infectious diseases, particularly those that are neglected by the market. Thank you.
Thank you, Dr. Sharma. Now I invite Vital Strategies to make a statement on their behalf on Agenda 9.5. On behalf of that, I invite Mr. L.M. Singh from Vital Strategies.
Thank you, Chair. Honorable Chair, Excellencies, distinguished guests, civil registration of births and deaths in Southeast Asian countries has seen encouraging progress in recent years. Yet significant gaps in coverage and system efficiency persist. Reliable CRVS data is foundational for legal identity, health and social welfare planning, mortality surveillance and evidence-based responses to health challenges. The health sector plays a central role in ensuring that every birth and death is counted, every cause of death is known, and that these data inform health policies and programs. As the first contact, health workers are uniquely positioned to notify registrars, support family submissions, and provide on-site registration. Shifting the notification burden to health agents strengthens completeness, timeliness, and responsive health systems. Through the Data for Health initiative, Vital Strategies has partnered with countries in the region to translate this vision into results. In Bangladesh, linking health and civil registration systems raised birth registration from 12% in 2016 to 49% in 2024. Updated WHO standard MCCD forms and new electronic platforms are enabling use of timely mortality data. Thailand has mandated stillbirth reporting in all public facilities and analyzed links between climate and mortality data. Sri Lanka has enhanced cause of death reporting. Across the region, national vital statistics and mortality reports are now informing life-saving policies, from cancer control strategies to HPV vaccination and NCD screening programs. We urge member states to leverage the health sector's infrastructure and data systems to strengthen CRVS, foster cross-sector collaboration, and ensure that no birth or death goes unrecorded. This will advance equity, accelerate SDG progress, and build resilient digital public infrastructures that leave no one behind. Thank you.
Thank you, Mr. Singh. And now invite Dr. Indira Sharma from the World Federation of Mental Health to make a statement on their behalf on Agenda 9.6.
Thank you, sir. Promoting physical activity in the WHO Southeast Asia region. Intense awareness programs are needed to educate the people about, one, the effect of physical activity in promoting mental health, decreasing cardiometabolic risk factors, and decreasing the risk for all causes of death. Two, types of exercise: aerobic, flexibility, muscle strengthening, balancing exercise, with aerobic exercise having the greatest health benefits. And three, that regular physical activity should be started soon after birth and maintained throughout the lifespan. Adults should engage in moderate intensity cardiorespiratory exercise training for equal to or greater than 30 minutes per day on at least 5 days a week, for a total of about 150 minutes per week. Or vigorous intense cardiorespiratory exercise training for about 20 minutes per day on at least 3 days a week, or a combination of both moderate and vigorous intensity exercise. Green exercise, that is exercise done in natural setting, has greater health benefits. Stationary running is recommended when outside options are unavailable. Clubbing it with music video or doing it in a group makes it more user-friendly and ensures regularity. Preference for climbing stairs rather than using lifts or escalators, and for walking or cycling rather than going in a car should be preferred. Persons aged over 40 years and those medically compromised should seek medical advice on the type of exercise. All education institutes must provide for regular sports 1 hour per day and annual sports for students, and exemption should be permitted only on medical grounds. Parents have the responsibility of arranging for children sports and physical activities on Sundays and holidays. At workplace, employers should provide avenues for sports, arrange annual sports, promote walking, cycling, cycle rickshaws, and prevent prolonged sitting for more than 4 hours at a time. It should be the state's responsibility to provide for cycle lanes and open spaces, that is parks, for sports in colonies with separate ones for women. And last but not the least, the hotels and high-rise buildings should provide access to stairs. Thank you very much.
Thank you, Dr. Sharma. Then I give the floor to BIMSTEC Secretariat. Now I invite Mr. K.K. Yoganandan, Director, BIMSTEC Secretariat, to make a statement on behalf on Agenda 9.7.
Thank you, Chair, and a very good morning to you and the distinguished delegates. It is a privilege to represent BIMSTEC the Bay of Bengal Initiative for Multi-Sectoral Technical and Economic Cooperation at the 78th session of the WHO Regional Committee for Southeast Asia region. I thank CRO for the invitation. It may be noted that all BIMSTEC members are also members of CRO. It is for the first time that BIMSTEC is participating at this session. BIMSTEC welcomes the committee's focus on strengthening primary health care, healthy aging, universal health coverage, antimicrobial resistance, and climate resilient health system, which fully align with the BIMSTEC's plan of action on public health. BIMSTEC plan of action has set out priorities for regional cooperation to realize the goal of ensuring health security for all through universal health coverage. This includes developing regional governance and coordination mechanisms, improving surveillance and early warning systems, identifying and strengthening centers of excellence for laboratory and genomic surveillance, building a regional One Health workforce and rapid response teams, and establishing regional stockpiles and contingency arrangement for point of entry. These priorities are intended to close standing gaps in preparedness and response. I am pleased to state that BIMSTEC has made steady progress in forging regional cooperation in health sector. I would like to mention the initiative of establishing BIMSTEC Center of Excellence on Tropical Medicine and Public Health in Thailand and BIMSTEC Center of Excellence in Traditional Medicine in India. At the 6th BIMSTEC Summit, our leaders directed convening of BIMSTEC Health Ministers meeting. Sri Lanka, as a lead country of the health sector, is planning to host it soon. BIMSTEC is working with the World Bank to commence implementation of project named South Asia Regional Capacity Building for Pandemic Prevention and Preparedness and Response One Health approach with a grant support of $4 million from the World Bank. To conclude, I would like to reiterate that desire of BIMSTEC to work in partner with WHO to address the challenges faced by all our member states in health sector. Thank you, Chair.
Thank you, Mr. Yogananthan, who represents the BIMSTEC Secretariat. I now invite Dr. Samudra Gunawardena to make a joint statement on behalf of United Nations University International Institute for Global Health and Public Services International on Agenda 9.8.
Thank you, Chair. Good morning to all. Honorable delegates, UNO, IIGH and PSI appreciate the opportunity to speak to agenda item 9.8. UNO IIGH is a think tank within the UN system working to advance equitable, just and effective global health policies and practices. PSI represents over 14 million health workers in 700 health and care sector unions worldwide. Collectively, we support the objective of strengthening the region's primary health care and commitments to prioritize primary health care in health budgets. However, a glaring omission concerns us. While the declaration speaks of investing in the health workforce, it is silent on health workers' fundamental rights, fair remuneration, and decent work conditions. We cannot build a resilient health system without a respected health and care workforce, whose needs are secured. The primary health care workforce, consisting primarily of women, is chronically understaffed, consistently denied their labor rights, and at heightened risk of gender-based violence, harassment, and abuse. Community health workers, for instance, are a backbone of primary health care, but not formally recognized as workers. As such, they are denied minimum wages, job security, and social protection, despite delivering critical health services to the most marginalized communities. The declaration's statements of identifying shared responsibilities among different cadres can easily become a mandate for task shifting to community health care workers without commensurate pay or rights. And digitalization carries major risk if the well-being and rights of health workers are not centered. We therefore call for the recognition of all community healthcare workers as public sector workers, in line with both the ILO nominative standards and WHO guidelines. We also recognize that the aggressive push by international financial institutions towards privatization of healthcare and austerity measures are cutting public spending on the health workforce in our countries. To conclude, we support the declaration goals, but we urge member states to invest in fundamental rights of their health workforce if they want to strengthen primary health care. Thank you.
Thank you, Dr. Samudra. I now invite Mr. Sharif Muhammad Sadat from the International Federation of Medical Students Association, IFMSA, to make a statement on their own behalf on Agenda 9.8. He's not here.
Honorable Chair, distinguished delegates, the International Federation of Medical Students Association welcomes the Delhi Declaration as a pivotal commitment to strengthen primary health care in the Southeast Asia region. PHC is a cornerstone of universal health coverage, ensuring equitable access to essential services, preventive care, and addressing social determinants of health, from community-level interventions to national and regional social system reforms. Despite progress, significant gaps persist. WHO estimates that nearly 40% of the region's population lacks access to essential PHC services. Workforce shortages are critical. 8 of 10 CRO countries have fewer than 4.45 skilled health professionals per 1,000 population, the minimum recommended for UHC. Rural and marginalized communities face compounded barriers, contributing to persistent maternal mortality rates and child stunting rates exceeding 30% in some countries. Digital and community health interventions remain unevenly implemented, limiting preventive care and health literacy. We, the IFMSA, representing 1.5 million medical students worldwide, urge WHO and member states to fully implement the Delhi Declaration, investing in accessible, high-quality, people-centered primary health care. Strengthen the health workforce with training, equitable development, and retention in underserved areas. Ensure sustainable financing, or increasing national budget allocations for primary health care and reducing out-of-pocket costs. Expand digital health, community engagement, and youth participation to enhance service delivery, preventive care, and health literacy. Ensure PHC systems and resilient, inclusive, and capable of addressing emerging challenges, including NCDs, outbreaks, and climate-related health risk. Monitor progress with disaggregated data to ensure equity, accountability, and evidence-based USC implementation. Strong PHC is a foundation for healthy communities, sustainable systems, and equitable outcomes. By empowering health professionals and youth, our region can accelerate progress towards UHC for all. Thank you.
Thank you, Mr. Sadat. Now I invite Dr. Tamilini Joseph Kumar from the World Vision International to make a statement on Agenda 9.8.
Thank you, Chair. Excellencies, distinguished delegates, and friends. I'm delivering this statement on behalf of World Vision International, a global humanitarian organization committed to improving the health and well-being of the most vulnerable children and communities. Thank you for the opportunity to contribute to this vital discussion. World Vision welcomes the Delhi Declaration on strengthening primary health care as a vital step toward achieving universal health coverage. We commend its focus on equity, resilience, and community participation principles that align deeply with our mission and daily work alongside vulnerable community. In here, we must think about the most vulnerable children, for those living in fragile context, displaced by migration, with disabilities, or from marginalized groups. PHC is not just a policy, it's a lifeline. These children face multiple barriers to accessing essential health services: physical inaccessibility, financial hardship, cultural exclusion, and systemic neglect. Without deliberate action, they risk being left behind. World Vision brings a grounded perspective from the front lines. In urban slums and remote villages, our team witnessed how under-resourced facilities, workforce shortages, and high out-of-pocket costs prevent children and caregivers from receiving timely quality care. We hear from mothers walking hours to reach clinics only to find no staff or medicine. We see children with disabilities excluded from routine services. These are not isolated incidents, they reflect systemic gaps. We urge member states to take bold child-focused action, invest in health workers, development and retention in underserved areas, strengthen PhD system with equity at the core, prioritizing children in migration with disabilities and from marginalized groups, support integrated programs in nutrition, early childhood development, and preventive health, increase public health financing to eliminate financial barriers. Achieving UHC is not only a health goal, it's a moral imperative. Let us ensure its promise reaches every child in every community without discrimination or delay. Thank you.
Thank you, Dr. Tamilini. And now the floor is to International League Against Epilepsy. Now I invite Dr. Sanjay Fernando from the International League Against Epilepsy to make statement on Agenda 9.8.
Thank you, Chair. Good morning, ladies and gentlemen. I'm representing the International League Against Epilepsy, the Asian and the Oceanian chapter. With an estimated regional prevalence ranging from 4.3 to 7.7 cases per 1,000 people, today we consider epilepsy as a major public health priority in our region. The Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders, IGAP 2022-31, was adapted to tackle the challenges faced by people with epilepsy. IGAP is advocated by the WHO, ILA, and the International Bureau for Epilepsy and sets strategic objectives to minimize the gaps in diagnosis, treatment, and outcomes. 90-80-70 target cascade is the key action plan in IGAP. 90% of people with epilepsy should be aware of their condition as a treatable brain disorder. 80% must have access to appropriate and affordable treatment. 70% of these treated must have achieved adequate seizure control. Achieving these targets fundamentally relies on training the primary healthcare workers on epilepsy and strengthening their networks. This is done by many Southeast Asian countries supported by standardized ILA education modules. Additionally, many countries are applying the SMART framework to achieve their targets, identifying specific gaps and catering and creating measurable national targets, developing an achievable, realistic plan, and setting time-bound agenda. Conclusion and suggestions. IGAP aims to improve the quality of life for people with epilepsy. Therefore, we urge all member states to invest in IGAP. Forming a co-action group is suggested to survey and audit regional progress against IGAP targets. We can affirm ILE regional chapter is ready to provide you with adequate technical assistance with this regard. Thank you very much.
Thank you, Dr. Sanjay. And now I invite Dr. Harshal Kale from the World Federation of Hemophilia to make a statement on behalf on Agenda 9.9.
Chair, Your Excellencies, distinguished delegates, the World Federation of Hemophilia, WFH, applauds the WHO Southeast Asia Regional Committee and its member state for the adoption of Delhi Declaration on improving access to essential medical products both in the region and beyond, and the progress made to date. The WFH calls for the implementation of effective procurement mechanisms to increase equitable access to treatment for people with hemophilia and other bleeding disorders. While safe and effective medicines exist, they remain out of reach for most patients in the region. the WHO's inclusion of several hemophilia treatments in the 2025 Essential Medicines List and Essential Medicines List for Children marks a critical step forward. The WFH commends the leadership of Armenia and Morocco with co-sponsorship from Nepal and Sri Lanka, who have tabled a formal proposal to WHO Executive Board to include a discussion on World Health Assembly resolution on global action to advance health equity for people with hemophilia and other inherited bleeding disorders in the agenda of the upcoming 158th session of the WHO Executive Board. People with hemophilia and other bleeding disorders face underdiagnosis, lack of access to treatment, leaving patients to suffer from chronic joint damage, disability, reduced quality of life, and premature death. This results in increased use of healthcare resources, placing a significant strain on health systems. Women with bleeding disorders also faced increased risk of anemia and iron deficiency, complications during pregnancy and childbirth, and even maternal and infant mortality. A WHO resolution would offer an essential global framework for WHO and its member state to address key barriers to increasing access to diagnosis, treatment, and care for people living with inherited bleeding disorders. We urge the WHO Southeast Asia Regional Committee and its member states to support this resolution. Thank you.
Thank you, Dr. Harshal. And I thank all the representatives who made observations and statements. And now I invite the WHO Secretariat to respond to the observations made by the distinguished delegates.
Thank you, Chair. Excellencies, distinguished delegates, the Secretariat extends its appreciation to all member states for the continued progress in implementing initiatives and measures to address NCDs, and we express our gratitude for the strong support for the expansion of CHEART's milestones for accelerating prevention and control of cardiovascular diseases. Sri Lanka's proposal that WHO conduct a clinical audit across the member states to ensure accurate protocol implementation and monitor effective hypertension and diabetes control is well noted under CHEARTS. Appreciate Thailand's strong policy measures and efforts for elimination of trans fatty acids and congratulate for receiving a WHO's validation certificate, the first in the region. We also congratulate India, Bhutan, and Thailand for already exceeding the national commitments under CHEARTS on hypertension and diabetes coverage and control, which has really helped us to revise the agenda item and come up with renewed targets. We have already extended invitations to member states to attend the regional meeting to revise the regional targets and national targets. The regional meeting will take place from 28th to 30th October in Jaipur, India, and we expect to finalize the new CHEARTS milestone, and we hope to see the NCD program managers and stakeholders in this meeting in Jaipur. We also welcome the strong support by member states for the extension of promoting physical activity, noting the excellent initiatives implemented by member states. Our region is the most vulnerable to the impacts of climate change, and as mentioned by several member states, and the declaration for building health systems resilience to climate change. Of course, the extension of framework took place in 2022 until 2027, and we have seen member states' strong support to extend it until 2030. Adopting this year's, it is in line with this year's World Health Assembly decision that was adopted, the Global Plan of Action. So we very much welcome it. Health National Adaptation Plan development and access to climate financing support that was requested by member states is well noted, which is part of the support that is already been provided. And 8 of the member states from our region have already made the COP26 health commitments and are active members of the Alliance for Transformative Action on Climate and Health, Attach initiative. We also acknowledge the progress made in revitalizing the school health program and health promoting schools in the region, and of course noted the interventions made by non-state actors. As requested by member states, the Secretariat reaffirms its continued commitment for providing technical guidance and support to facilitate the effective implementation of the decisions that will be made by member states. Over to you, Chair.
Thank you for your response. And now I invite WHO senior management for their comments. Yeah.
Thank you, Chair. Thank you, Your Excellencies and distinguished delegates. This is in regards to Agenda 9.3. We welcome and commend the efforts by the member states to achieve the highest level of immunization coverage in children in Southeast Asia region in 2024. And with regards to specifically measles and rubella, the overall coverage increased to 95% in the first dose and second dose of 90%. And also appreciate the continued maintenance of elimination of measles in 4 countries and rubella now in 6 countries in the region. And we also especially acknowledge and appreciate the efforts by Sri Lanka on the strong public health capacity in managing the measles outbreak by addressing the immunization gaps. We also noted the continued challenges mentioned, including cross-border collaboration efforts, financial constraints, and addressing the subnational variations in immunization. WHO reaffirms its commitment to continue to collaborate and provide technical support and building partnerships to support the member states in achieving malaria elimination transmission of measles and rubella by 2026 as per the current RC resolution. And CRO will also work together with the countries and partners to mobilize the required resources. Thank you. Over from my side.
Now, response over 9.5, 9.8 and 9.9 by HSD.
Thank you, Chair. Thanks all member states. I think all countries did mention about their new and revised policies or strategies or approaches or frameworks or interventions, initiatives while responding to the progress reports relating to agenda item 9.5 or 9.8 9.5 relating to CRVS or 9.8 relating to strengthening PHC, 9.9 relating to improving access to essential medical products. And also thanks to various partners and organizations on touching on these agenda points. I'm not naming each of them. But what we noticed was that almost everyone made interventions around strengthening resilient PHC, around strengthening health information systems, improving access to medical products, whether directly reporting to those agenda items or even by responding to other agenda items relating to health system resilience or prevention and control of cardiovascular diseases, immunization, etc. So strengthening primary health care was a common running theme across all different agenda points. Also, while they spoke of strengthening PHC, also spoke of leveraging digital technologies for integrated electronic health records, and broadly spoke of improving access to essential medical products to provide affordable and quality accessible care. I will like to touch on the agenda, specifically on progress in the decade for strengthening the role of health sector in improving CRVS in our region. Several member states touched on this. So we do recognize that robust CRVS form the cornerstone of national health information systems and provide the most continuous, complete, and sustainable source of data on birth, deaths, and cause of death. I'd like to emphasize, if every birth is not counted, the denominator for most health indicators becomes incorrect. Similarly, if every death is not registered, and the cause of death is inaccurately reported, the numerator for mortality indicators is flawed, which compromises the accuracy of national and global health statistics. So, critical to strengthen CRVS and only improving data on births, deaths, but also causes of death. They remain critical to achieving the UHC and several of our health-related SDG indicators. And we need to recognize that health sector plays not only a pivotal role as a key data provider, but also as a primary beneficiary of resilient and inclusive CRVS systems. Other thing is about 70% of deaths occurring outside of the health facilities. So we did notice some countries mentioning, but important to apply verbal autopsy methods to determine probable causes of death. I'm happy to note good progress around ICD implementation, ICD-11 implementation in the region, but we need to make progress. So I did notice that all member states spoke of universal and responsive CRVS through strengthened MOH leadership, using digital technologies, and making sure, as requested by the member states, WHO will continue to provide technical support, capacity building, also developing regional implementation with actionable guidelines, using convening power to bring partners to provide aligned and harmonized support. We have noticed the specific support for verbal autopsy, digital integration of CRVS, also support for ICD-11 implementation, and we will continue to provide support for that. We have also noted specific requests from Sri Lanka around leveraging regional platforms like CERN and Regional PHC Forum for knowledge management, and will continue to do so. Thank you so much.
Response by Secretariat on 9.7. WHE.
Thank you, Chair. Good morning, distinguished delegates, Your Excellencies. So, strengthening emergency preparedness and Delhi Declaration implementation, we have taken note of all the member states' interventions, initiatives, programs for strengthening emergency preparedness in the region. As highlighted in the paper, the Secretariat has made significant efforts through regional health security roadmap, through implementing global health emergency preparedness and response framework. But I want to make three important points from the interventions of the member states. First, most member states mentioned the importance of multi-sectoral engagement for strengthening health emergency preparedness. And last year, the regional committee agreed in principle for establishment of the Regional Health Emergency Council, which provides a platform for intersectoral engagement, multi-sectoral engagement in a continued way, but also regional cooperation and regional solidarity when we have to take care of medical countermeasures, making new medicines, diagnostics, therapeutics available for any public health emergency of international concern. The second point which DG also mentioned, that we highly appreciate member states' commitment to realize, to finalize the pandemic agreement, and particularly regional one voice to ensure the pathogen access and benefit sharing mechanism annexure to the pandemic agreement by next World Health Assembly. This is very much in line with what we have been advocating for since Delhi Declaration. And the third important point is implementing IHR amendments, the revised IHR. The Secretariat has been talking to member states for establishment of national IHR authorities to strengthen the IHR core capacities. And as Thailand mentioned,
the example of the UHPR, Universal Health Preparedness and Review, and we also understand that after Thailand pilot, now Sri Lanka is ready to undergo that pilot for UHPR in the coming months. We highly appreciate Member States' commitment for this, and CRO remains available for providing technical assistance and support for these mechanisms. Last year also I want to mention that the regional, in addition to the regional health security roadmap, we have now strategic action framework for community engagement and resilience, which is a very important area for emergency preparedness. With that, thank you for your commitment. We appreciate and have taken note of all your interventions. Thank you. Back to you, Chair.
Thanks to the Secretariat. And now I invite WHO senior management to make their comments on observations and statements made by the delegates. Right, we can move to the next item. Excellencies and distinguished delegates, I have the pleasure in inviting the officer in charge, Dr. Katharina Boime, to launch 2 publications titled, number 1, Progress Report on CHART's Milestones, Accelerating Prevention and Control of Cardiovascular Diseases in the Southeast Asia region, and number 2, Access to Medical Products in Southeast Asia region 2025. Thank you, Dr. Katharina. Distinguished delegates, this brings us to the end of this agenda item. And now it's just time for some physical activity. May I request the Secretariat to lead us through the 3-minute physical activity break.
Thank you, Chair. For this morning, we've got staff from Ministry of Health to lead us. Perhaps.
Good morning, Chair, Excellencies, delegates, and everyone. On behalf of the Directorate of Non-Communicable Diseases, Ministry of Health and Mass Media, Sri Lanka, I welcome you all to join us with some physical activity. You may please stand, push your chair back, and refresh yourselves. Thank you.
Thank you all for your participation. And now let us take a short coffee break for 20 minutes. Yes. We'll join back to conduct the further session. Any announcement by the Secretariat? No? Nothing? Right. No? At 11 we meet. Nothing. Right. Thank you. The meeting is now adjourned and we will meet after the tea break at 11 o'clock. Thank you.
Distinguished ministers, esteemed colleagues, it's an honor to address you at the 78th session of the WHO Regional Committee for Southeast Asia. Representing the public health needs of over 2 billion people, the work of the WHO's Southeast Asia region remains vital, especially as we navigate evolving geopolitical and economic challenges. Despite these hurdles, it is important to acknowledge the progress achieved by member states and the historic milestone represented by the adoption of the pandemic agreement, a singular opportunity to make the world safer for all. Going forwards, the Southeast Asia region, known for its leadership, its innovation, and its resilience, will play a crucial role in strengthening our global pandemic defenses. The region's impressive vaccine manufacturing capabilities and technical expertise have laid the foundation for a safer, healthier future, a future where we are equipped to rapidly and equitably face down emerging viral threats like chikungunya, Mpox, and Nipah virus, all of which have impacted the region in recent months. While we cannot avoid these threats entirely, we can and we must prepare for them. COVID-19 remains a stark reminder of the deadly and devastating consequences of underpreparedness in the face of emerging threats. Yet the scientific advances born out from the COVID-19 response have pointed to a new paradigm for pandemic preparedness, one where we can now feasibly hope to have vaccines against emerging viral threats in 100 days. Accomplishing this 100 days mission, a mission conceived by my organization, backed by the G7 and G20, will require new approaches to R&D, manufacturing, and approvals to speed up vaccine development and to support equitable access. The success of the 100 days mission hinges on unwavering collaboration to collectively shape a stronger, more resilient regional health infrastructure, ready to respond with unprecedented speed. Such collaborations are more than just alliances. They are engines for innovation and progress. So I call on each of you, ministers, policymakers, scientists, regulators, industry leaders, to combine our expertise, coordinate our strategies, and forge the lasting partnerships that will be necessary to achieve the 100 days mission, to protect Southeast Asia and the world. Thank you for your leadership, partnership, and unwavering commitment to the health and well-being of all. Distinguished ministers, esteemed colleagues, it's an honor to address you at the 78th session of the WHO Regional Committee for Southeast Asia. Representing the public health needs of over 2 billion people, the work of the WHO's Southeast Asia region remains vital, especially as we navigate evolving geopolitical and economic challenges. Despite these hurdles, it is important to acknowledge the progress achieved by member states and the historic milestone represented by the adoption of the pandemic agreement, a singular opportunity to make the world safer for all. Going forwards, the Southeast Asia region, known for its leadership, its innovation, and its resilience, will play a crucial role in strengthening our global pandemic defenses. The region's impressive vaccine manufacturing capabilities and technical expertise have laid the foundation for a safer, healthier future, a future where we are equipped to rapidly and equitably face down emerging viral threats like chikungunya, Mpox, and Nipah virus, all of which have impacted the region in recent months. While we cannot avoid these threats entirely, we can and we must prepare for them. COVID-19 remains a stark reminder of the deadly and devastating consequences of underpreparedness in the face of emerging threats. Yet the scientific advances born out from the COVID-19 response have pointed to a new paradigm for pandemic preparedness, one where we can now feasibly hope to have vaccines against emerging viral threats in 100 days. Accomplishing this 100 days mission, a mission conceived by my organization, backed by the G7 and G20, will require new approaches to R&D, manufacturing, and approvals to speed up vaccine development and to support equitable access. The success of the 100 days mission hinges on unwavering collaboration to collectively shape a stronger, more resilient regional health infrastructure, ready to respond with unprecedented speed. Such collaborations are more than just alliances. They are engines for innovation and progress. So I call on each of you, ministers, policymakers, scientists, regulators, industry leaders, to combine our expertise, coordinate our strategies, and forge the lasting partnerships that will be necessary to achieve the 100 days mission, to protect Southeast Asia and the world. Thank you for your leadership, partnership, and unwavering commitment to the health and well-being of all. Distinguished ministers, esteemed colleagues, it's an honor to address you at the 78th session of the WHO Regional Committee for Southeast Asia. Representing the public health needs of over 2 billion people, the work of the WHO's Southeast Asia region remains vital, especially as we navigate evolving geopolitical and economic challenges. Despite these hurdles, it is important to acknowledge the progress achieved by member states and the historic milestone represented by the adoption of the pandemic agreement, a singular opportunity to make the world safer for all. Going forwards, the Southeast Asia region, known for its leadership, its innovation, and its resilience, will play a crucial role in strengthening our global pandemic defenses. The region's impressive vaccine manufacturing capabilities and technical expertise have laid the foundation for a safer, healthier future, a future where we are equipped to rapidly and equitably face down emerging viral threats like chikungunya, mpox, and Nipah virus, all of which have impacted the region in recent months. While we cannot avoid these threats entirely, we can and we must prepare for them. COVID-19 remains a stark reminder of the deadly and devastating consequences of underpreparedness in the face of emerging threats. Yet the scientific advances born out from the COVID-19 response have pointed to a new paradigm for pandemic preparedness, one where we can now feasibly hope to have vaccines against emerging viral threats in 100 days. Accomplishing this 100 days mission, a mission conceived by my organization, backed by the G7 and G20, will require new approaches to R&D, manufacturing, and approvals to speed up vaccine development and to support equitable access. The success of the 100 Days mission hinges on unwavering collaboration to collectively shape a stronger, more resilient regional health infrastructure, ready to respond with unprecedented speed. Such collaborations are more than just alliances. They are engines for innovation and progress. So I call on each of you, ministers, policymakers, scientists, regulators, industry leaders, to combine our expertise, coordinate our strategies, and forge the lasting partnerships that will be necessary to achieve the 100 Days mission, to protect Southeast Asia and the world. Thank you for your leadership, partnership, and unwavering commitment to the health and well-being of all. Distinguished ministers, esteemed colleagues, it's an honor to address you at the 78th session of the WHO Regional Committee for Southeast Asia. Representing the public health needs of over 2 billion people, the work of the WHO's Southeast Asia region remains vital, especially as we navigate evolving geopolitical and economic challenges. Despite these hurdles, it is important to acknowledge the progress achieved by member states and the historic milestone represented by the adoption of the pandemic agreement, a singular opportunity to make the world safer for all. Going forwards, the Southeast Asia region, known for its leadership, its innovation, and its resilience, will play a crucial role in strengthening our global pandemic defenses. The region's impressive vaccine manufacturing capabilities and technical expertise have laid the foundation for a safer, healthier future, a future where we are equipped to rapidly and equitably face down emerging viral threats like chikungunya, mpox, and Nipah virus, all of which have impacted the region in recent months. While we cannot avoid these threats entirely, we can and we must prepare for them. COVID-19 remains a stark reminder of the deadly and devastating consequences of underpreparedness in the face of emerging threats. Yet the scientific advances born out from the COVID-19 response have pointed to a new paradigm for pandemic preparedness, one where we can now feasibly hope to have vaccines against emerging viral threats in 100 days. Accomplishing this 100 days mission, a mission conceived by my organization, backed by the G7 and G20, will require new approaches to R&D, manufacturing, and approvals to speed up vaccine development and to support equitable access. The success of the 100 Days mission hinges on unwavering collaboration to collectively shape a stronger, more resilient regional health infrastructure, ready to respond with unprecedented speed. Such collaborations are more than just alliances. They are engines for innovation and progress. So I call on each of you, ministers, policymakers, scientists, regulators, industry leaders, to combine our expertise, coordinate our strategies, and forge the lasting partnerships that will be necessary to achieve the 100 days mission to protect Southeast Asia and the world. Thank you for your leadership, partnership, and unwavering commitment to the health and well-being of all. Distinguished ministers, esteemed colleagues, it's an honor to address you at the 78th session of the WHO Regional Committee for Southeast Asia. Representing the public health needs of over 2 billion people, the work of the WHO's Southeast Asia region remains vital, especially as we navigate evolving geopolitical and economic challenges. Despite these hurdles, it is important to acknowledge the progress achieved by member states and the historic milestone represented by the adoption of the pandemic agreement, a singular opportunity to make the world safer for all. Going forwards, the Southeast Asia region, known for its leadership, its innovation, and its resilience, will play a crucial role in strengthening our global pandemic defenses. The region's impressive vaccine manufacturing capabilities and technical expertise have laid the foundation for a safer, healthier future, a future where we are equipped to rapidly and equitably face down emerging viral threats like chikungunya, Mpox, and Nipah virus, all of which have impacted the region in recent months. While we cannot avoid these threats entirely, we can and we must prepare for them. COVID-19 remains a stark reminder of the deadly and devastating consequences of underpreparedness in the face of emerging threats. Yet the scientific advances born out from the COVID-19 response have pointed to a new paradigm for pandemic preparedness, one where we can now feasibly hope to have vaccines against emerging viral threats in 100 days. Accomplishing this 100 days mission, a mission conceived by my organization, backed by the G7 and G20, will require new approaches to R&D, manufacturing, and approvals to speed up vaccine development and to support equitable access. The success of the 100 days mission hinges on unwavering collaboration to collectively shape a stronger, more resilient regional health infrastructure, ready to respond with unprecedented speed. Such collaborations are more than just alliances. They are engines for innovation and progress. So I call on each of you, ministers, policymakers, scientists, regulators, industry leaders, to combine our expertise, coordinate our strategies, and forge the lasting partnerships that will be necessary to achieve the 100 days mission to protect Southeast Asia and the world. Thank you for your leadership, partnership, and unwavering commitment to the health and well-being of all. Distinguished ministers, esteemed colleagues, it's an honor to address you at the 78th session of the WHO Regional Committee for Southeast Asia. Representing the public health needs of over 2 billion people, the work of the WHO's Southeast Asia region remains vital, especially as we navigate evolving geopolitical and economic challenges. Despite these hurdles, it is important to acknowledge the progress achieved by member states and the historic milestone represented by the adoption of the pandemic agreement, a singular opportunity to make the world safer for all. Going forwards, the Southeast Asia region, known for its leadership, its innovation, and its resilience, will play a crucial role in strengthening our global pandemic defenses. The region's impressive vaccine manufacturing capabilities and technical expertise have laid the foundation for a safer, healthier future, a future where we are equipped to rapidly and equitably face down emerging viral threats like chikungunya, Mpox, and Nipah virus, all of which have impacted the region in recent months. While we cannot avoid these threats entirely, we can and we must prepare for them. COVID-19 remains a stark reminder of the deadly and devastating consequences of underpreparedness in the face of emerging threats. Yet the scientific advances born out from the COVID-19 response have pointed to a new paradigm for pandemic preparedness, one where we can now feasibly hope to have vaccines against emerging viral threats in 100 days. Accomplishing this 100 days mission, a mission conceived by my organization, backed by the G7 and G20, will require new approaches to R&D, manufacturing, and approvals to speed up vaccine development and to support equitable access. The success of the 100 Days mission hinges on unwavering collaboration to collectively shape a stronger, more resilient regional health infrastructure, ready to respond with unprecedented speed. Such collaborations are more than just alliances. They are engines for innovation and progress. So I call on each of you, ministers, policymakers, scientists, regulators, industry leaders, to combine our expertise, coordinate our strategies, and forge the lasting partnerships that will be necessary to achieve the 100 Days mission, to protect Southeast Asia and the world. Thank you for your leadership, partnership, and unwavering commitment to the health and well-being of all. Distinguished ministers, esteemed colleagues, it's an honor to address you at the 78th session of the WHO Regional Committee for Southeast Asia. Representing the public health needs of over 2 billion people, the work of the WHO's Southeast Asia region remains vital, especially as we navigate evolving geopolitical and economic challenges. Despite these hurdles, it is important to acknowledge the progress achieved by member states and the historic milestone represented by the adoption of the pandemic agreement, a singular opportunity to make the world safer for all. Going forwards, the Southeast Asia region, known for its leadership, its innovation, and its resilience, will play a crucial role in strengthening our global pandemic defenses. The region's impressive vaccine manufacturing capabilities and technical expertise have laid the foundation for a safer, healthier future, a future where we are equipped to rapidly and equitably face down emerging viral threats like chikungunya, Mpox, and Nipah virus, all of which have impacted the region in recent months. While we cannot avoid these threats entirely, we can and we must prepare for them. COVID-19 remains a stark reminder of the deadly and devastating consequences of underpreparedness in the face of emerging threats. If the scientific advances born out from the COVID-19 response have pointed to a new paradigm for pandemic preparedness, one where we can now feasibly hope to have vaccines against emerging viral threats in 100 days. Accomplishing this 100 days mission, a mission conceived by my organization, backed by the G7 and G20, will require new approaches to R&D, manufacturing, and approvals to speed up vaccine development and to support equitable access. The success of the 100 Days mission hinges on unwavering collaboration to collectively shape a stronger, more resilient regional health infrastructure, ready to respond with unprecedented speed. Such collaborations are more than just alliances. They are engines for innovation and progress. So I call on each of you, ministers, policymakers, scientists, regulators, industry leaders, to
spotlight is hitting us. It's not. Yeah, it is. I suppose it's supposed to hit him, but not with the intensity that it's hitting us. When I was at the Treasury Department, Bonner came to see our summer. We brought him sunglasses. He said something, we were inscribed inside something like, "Who's something for a fly guy?" Which has to have been one of the best things that Larry was given as Treasury Secretary. Yeah, it is pretty cool. Richard Gere came to the National Security Council when I was there, but I didn't really, I saw him, but he's not short. Yes.
And that's interesting.
Yeah, I mean, he's taller than I am, but not, he's no towering.
And some film stars are. Mr. Cleese.
Yes. Well, it won't make any sense to you, but I think that Richard Gere is something like 5'7", and I'm.
I think we do.
Okay.
Right. All right, okay. Excellencies, distinguished delegates, shall we start now? Okay. Let us now take up agenda item number 7, program budget matters. I wish to inform you that this agenda item has been extensively deliberated upon by our representatives at the 18th meeting of the Subcommittee on Policy and Program Development and Management, held in August 2025, and they made recommendations for consideration by the 78th session of the Regional Committee. The working papers available online provide full background on each item. We may therefore like to focus our deliberations on the key points which have been placed in the text box on the cover page of each working paper. As you will observe, agenda item 7 has two sub-items. Let us first take up sub-item 7.1. This is Program Budget 2024-2025, Implementation and Mid-Term Review. Consistent with WHO's accountability framework, the working paper includes the progress made on number 1, mid-term review of the program budget 2024-2025 till the end of December 2024, and number 2, financing and implementation of the program budget 2024-2025 in the first 21 months up to September 2025 of the biennium in the SE Asia region. Please refer to the updated status in annexures. I am pleased to note that the Southeast Asia region continues to lead all major officers in terms of percentage utilization of distributed resources. The working paper, along with the SPPDM recommendations and its addendum, is presented to the 78th session of the WHO Regional Committee for Southeast Asia for its consideration. I now give the floor to the honorable delegates to make their comments and observations on the subject. I invite India to make the observations.
Thank you, Chair. India takes note of the implementation and midterm review of Program Budget 2024-25. India acknowledges the significance of the Program Budget 2024-2025, recognizing it as the concluding phase of the extended 13th General Program of Work. We also appreciate the one clear narrative, a single consolidated narrative for each output, providing a more holistic and coherent view of collective achievements. Chair, India notes that among the 10 results highlighted in the WHO results report, the areas of data and innovation and access to medical products show relatively low utilization. This underscores the need to accelerate progress in strengthening health information systems and ensuring access to affordable, quality-assured medical products. India emphasizes that effective translation of available funds into tangible outcomes require timely disbursement, enhanced country-level implementation capacities, and stronger accountability mechanisms. As we approach the end of the biennium, targeted reprogramming and focused capacity building in low-performing areas could significantly improve efficiency and impact. Chair, we note that WHO CRO has received 87% of the approved program budget fund and achieved a 70% utilization rate. This also presents an opportunity to expedite the utilization of the remaining 30% of the budget within the stipulated timeline, ensuring that planned activities are implemented effectively and in a timely manner. India urges expediting fund utilization in accordance with the approved Program Budget 2024-25 to ensure the timely implementation of planned initiatives and to maximize the impact of resource allocation towards achieving the region's health priorities and the broader objectives of the program budget. Chair, in the prevailing context of financial uncertainties, India underscores the imperative to safeguard and enhance the momentum of healthcare delivery, ensuring uninterrupted and accelerated progress towards achieving the agreed health priorities that are closely aligned with country-level needs. Resource constraints must not delay or hinder the impact of ongoing or novel initiatives. Rather, these challenges should be leveraged as a catalyst for fostering greater innovation, efficiency, and collaboration, thereby strengthening and sustaining program implementation in a more effective and resilient manner, and upholding WHO's commitment to equitable health outcomes across all member states. We look forward to actively participating in joint regular monitoring and assessment of the program budget 2024-2025 and contributing to the joint operational planning of the program budget 2026-2027. Thank you.
Thank you, India. Then now the floor to Sri Lanka for the comments and observations on this matter, followed by Maldives.
Thank you, Chair. Sri Lanka acknowledges the working paper along with the recommendations of the SPPDM meeting, which are submitted to the 78th session of the WHORC, and note that the Sierra region has the highest percentage utilization of distributed resources at 80%, and co-highest of percentage implementation of distributed resources at 71%. We also note that the approved regional program budget 2024-2025 classified by strategic priorities and segments, distributed resources, utilization and implementation across all strategic priority segments, percentage implementation versus resources is above 70%. While the approved program budget has an overall funding of 87% at this stage, funding by strategic priorities and segments are uneven, while health emergencies remains the least funded at 56%. Sri Lanka appreciates the funding received and the health outcome it has achieved, while noting that despite the cost efficiency measures put in place due to current funding situation, implementation in the current biennium under the base segment is higher by 16% as compared to the previous biennium 2022-2023. While acknowledging the need for the cost efficiency measure, we wish to highlight the need for in-depth assessment to determine the how user-friendly fund utilization is comparative to the other source of funding in human resource limited situations as compared with the government funds from other UN partners agencies. Perceive that this will facilitate, enable, ensure efficient and effective fund utilization. Thank you, Chair.
Thank you. Then I invite Maldives, followed by Nepal.
Thank you, Chair. The Maldives appreciates the Secretariat's presentation of the Results Report 2024, which provides a comprehensive midterm assessment of the implementation of the Program Budget 24-25. We commend the commitment to transparency, accountability, and results-based management, which is clearly reflected in the reporting. We welcome the progress made towards GPW 13 triple billion targets, particularly the advances in universal health coverage, protection from health emergencies, and healthier populations. Notable achievements such as the expansion of essential health services, strengthened pandemic preparedness, progress in disease elimination, and new initiatives on maternal and newborn health reflect WHO leadership in driving measurable results at country level. At the same time, we recognize the overall progress remains insufficient to achieve the health-related SDGs. Challenges such as reduced official development assistance and resource limitations. Maldives underscores the importance of sustained and predictable financing to enable WHO to deliver effectively on its mandate. We note with appreciation WHO efforts to support member states through initiatives in maternal and newborn health, mental health, vaccine development, disease elimination, and emergency preparedness. These efforts are vital for small island developing states like Maldives, which remain highly vulnerable to both health and climate-related shocks. We acknowledge WHO institutional reforms, including the launch of the investment round, strengthening governance mechanisms, enhanced digital health capacity, and efforts to integrate equity, gender, and human rights across this work. These are critical steps to ensure WHO remains fit for purpose in an increasingly complex health landscape. Looking ahead, Maldives stresses the need for continued focus on country-level delivery, alignment with national priorities, and targeted support for health system resilience. We encourage WHO to maintain its emphasis on flexibility, equity, and measurable results, and to ensure that lessons learned from the midterm review guide the successful completion of Program Budget 24-25 and the transition into GPW 14. Maldives reaffirms its support for WHO leadership in advancing global health, and we remain committed to working closely with the Secretariat, Regional Office, and Country Office to ensure that the implementation of the program budget delivers tangible benefits for our people. Thank you, Chair.
Thank you. Now floor to Nepal, followed by Bangladesh.
Thank you, Chair. Nepal welcomes the draft results report on the mid-term review of the program budget 2024-2025. It reflects clear progress towards the triple billion targets and health outcomes while demonstrating a commitment to value for money, efficient resource use, and result-based management. This mid-term review is more than a stock take. It is a moment to recalibrate and ensure resources are effectively reallocated where most needed. The joint review of program budgets provides accountability and transparency, while the focus on the country-level impact and output scorecards helps us see how investments translate into result on the ground. Chair, allow me to highlight some progress from Nepal, where 5 results are featured in the report. First, strengthening digital health through operationalization of the Nepal Health Facility Registry, which now documents over 11,000 health facilities and 35,000 health workers. Secondly, endorsement of the National Action Plan on Antimicrobial Resistance 2.0, supported directly by WHO. Third, innovative vaccination strategies to improve access and engagement, helping to increase immunization rates. Fourth, the launch of Bagmati Hypertension Care Cascade Initiative with the ambition of enrolling 1.5 million patients in treatment by 2025. And fifth, effective resource management with 80% of resources reallocated at the country level, reinforcing efficiency and responsiveness to national priorities. Looking ahead, Nepal encourages WHO to continue supporting member states in achieving GPW13 and SDG targets while preparing for a smooth transition to GPW14. Joint assessment and validation of outputs remain vital, and we must also carefully consider the feasibility of achieving the GPW13 outcome and impact targets by the end of 2025, ensuring alignment with the monitoring framework of GPW14. At last, we reaffirm our commitment to working with WHO to ensure that the program budget remains well managed, result-oriented, and firmly anchored in country-level impact. Thank you.
Thank you, Delegate from Nepal. Then I invite Delegate from Bangladesh, followed by DPR Korea.
Honorable Chair, distinguished delegates, excellencies, Program Budget 2024-2025. Bangladesh is pleased to join this important discussion on the midterm review of the Program Budget 2024-25 and to share our progress towards achieving the triple billion targets. We acknowledge WHO's continued support in strengthening our health system and commend the organization's efforts in prioritizing outputs that directly contribute to health outcomes in member states. Allow me to highlight some Bangladesh key achievements over the past year. First, strengthening primary health care remains central to our universal health coverage agenda. Guided by the Bangladesh Digital Health Strategy, we are working to expand access to quality services, reduce out-of-pocket expenditures, and enhance regulatory frameworks for medicines and vaccines. Second, Bangladesh launched a nationwide human papillomavirus vaccination campaign in 2024, covering 8.1 million girls aged 10 to 14 years, including 70,000 Rohingya girls in Cox's Bazar. By the end of the year, 7.2 million girls were vaccinated, reaching an impressive 89% coverage. This initiative sets a strong foundation towards eliminating cervical cancer as a public health threat. Third, Bangladesh successfully completed its second joint external evaluation of international health regulations capacities in July 2024 using the new JE platform. This marks a significant milestone in health security. The evaluation reaffirmed our strengths in vaccination, achieving more than 95% full child immunization coverage, and in advancing the One Health approach. Moving forward, we will develop a new 5-year national action plan for health security, with a focus on resource mobilization to address remaining gaps. Fourth, we have prioritized mental health, a long neglected area. With WHO support, more than 350 healthcare providers were trained under the GAP program in both primary healthcare facilities and humanitarian settings, reaching over 1 million people, including refugees. Despite challenges such as stigma and staff turnover, innovative approaches like telemental health are helping us reduce the treatment gap. Finally, in Cox's Bazar, we have scaled up hepatitis C screening and treatment services in partnership with WHO and other stakeholders. By December 2024, more than 10,000 individuals were screened, with over 4,000 positive cases identified, and treatment expanded across multiple facilities. Excellencies, Bangladesh experience underlines several lessons: the importance of political commitment, community engagement to counter vaccine hesitancy, innovative service delivery models such as telemedicine, and strong partnership with WHO and development partners. These have been critical in sustaining progress towards the 3 billion targets. Bangladesh reaffirms its commitment to working with WHO and member states to accelerate progress on universal health coverage, strengthening health emergency preparedness, and promote healthier population across our region. Thank you, Mr. Chair.
Thank you, Professor. And now I invite delegates from DPR Korea, followed by Timor-Leste.
Thank you, Chair. We would like to appreciate that the Southeast Asia region is taking the leading place in the implementation of Program Budget 2024-2025, but financing level is still considered low, and it is regretful that the funding level to our country is 33%, which is considered the lowest in the region. As of end of July, the implementation against distributed resources to DPR Korea is 91%, and we are anticipating 100% implementation before the end of this year. Based on the experiences and lessons learned in implementation of current biennium, we would like to underline the importance of correct budget planning and ensuring fund allocation as much as planned budget. In addition, it is suggested to raise funding level as high as possible in the first year of the biennium and implementation rate to 70 to 80% by close collaboration with the regional office and country offices. Thank you.
Thank you. Now I invite delegates from Timor-Leste, followed by Thailand.
Honorable Chair, Excellencies, ladies and gentlemen, Timor-Leste acknowledges and deeply appreciate the effort of WHO Secretariat in implementing the program budget 2024-2025. We particularly value the Secretariat focus on transparency, accountability, and country-level delivery as reflected in the Result Report 2024. During the current biennium, 88% of Timor-Leste allocated base segment program budget has been financed. We take this opportunity to convey our sincere gratitude to WHO, all the partners and stakeholders for their continued contribution towards improving the health of well-being of Timor-Leste people. Their support has been instrumental in advancing our healthcare agenda. Against the available resource, Timor-Leste implementing rate currently stands at 69%, with a utilization rate of 73% and with ongoing effort for higher implementation. We note with interest the midterm assessment report, which highlight steady progress towards the triple billion target, including expanded essential service coverage, strengthened pandemic preparedness, and surpassing the milestone of 1 billion people enjoying healthier lives. At the same time, the report reminds us that the challenges remain, particularly in achieving health-related sustainable development goals by 2013, and underscore the importance of sustainable and predictable finance to maintain momentum. Timor-Leste acknowledged WHO support in strengthening health system, advancing universal health coverage, expanding immunization, addressing communicable and non-communicable disease, and building resilience against health emergency with One Health framework. These align closely with the top priority area outlined in the results report, including primary health care, emergency preparedness, health workforce development, and social determinants of health. We committed to working with WHO to sustain program to the remainder period of biennium and to ensure that the lesson learned meaningfully inform the planning and implementation of the program budget 2026-2027 and the 14th generation and the 14th general program of work. Thank you.
Thank you. Now the floor to delegate from Thailand.
Chair, Thailand commends the Secretariat for the comprehensive midterm review of the program budget 2024 to 2025 and recognize the impressive progress achieved by the Southeast Asia region. With 87% of the regional budget funded and implementation rate of 71% of distributed resources, our region continues to demonstrate effective financial stewardship and strong delivery at country level. We particularly appreciate WHO's strengthened focus on result-based management, transparency, and accountability, as reflected in the unified narrative reporting approach and the incorporation of regional insights in the result report 2024. This improvement provide member states with clearer visibility on how resources are translated into impact. It is also noteworthy that progress under the triple billion targets continues, with measurable advances in universal health coverage, health emergency protection, and healthier populations. However, as underlined in the midterm assessment, challenges persist, particularly in sustaining momentum under Pillar 2 and 4, where funding and operational gaps remain. Ensuring equitable support across all strategic priorities is critical as we move toward the transition from GPW 13 to GPW 14. Thailand supports the ongoing reforms under the investment round and welcomes the WHO's continued engagement with member states to strengthen resource mobilization and risk management. We also commend the WHO for ensuring nearly 80% of the region's total resources are directed to country offices, a clear reflection of its commitment to country-level impact. Looking forward, we encourage sustained collaboration between the WHO and member states to enhance joint monitoring, ensure alignment with forthcoming program budget 2026 to 2027, and maintain continuity during the transition to GPW 14. Chair, Thailand wishes to commend the WHO and all member states for their collective progress and accountability in implementing this program budget. The achievements reported are not only numbers, but a testament to our shared commitment to deliver measurable, equitable, and sustainable impact for the people of our region. Thank you, Chair.
Thank you, delegates. 8 member states made their observations and comments on item 7.1, that is Program Budget 2024-2025, Implementation and Midterm Review. Thank you. And I invite WHO Secretariat to respond to the observation and comments made by the distinguished delegates.
Thank you, Chair, Excellencies, distinguished delegates. Thank you for all your commitments in implementing the program budget 24-25. This biennium is not an easy biennium for us. We know that with the financial constraints we had, but still, as CRO, we could ensure that country level, the country focus is maintained. The more resources at the country level, if you all review the reports, it's obvious. What we request now is the last mile, the implementation, so that we can complete the program budget 24-25 successfully. It's very important because this is the last biennium of the GPW 13 results framework we are reporting on. And as you all have highlighted, in our region, we have achieved a lot. And when we listen to all the interventions from the countries, it's very clear our priorities, which we selected under GPW 13, remain same. Immunization, primary health care, emergencies, essential medicine, and it cut across all the countries. And it's very important that we take that to the GPW 14. Coming back to all the intervention, now we have the utilization, but it's important that we translate that into the implementation at the end of the biennium and close this biennium very successfully. So, and then moving forward for the 24-25, the biennium, we had to do the joint monitoring. The CRO we have this tradition of doing the joint planning, as well as we piloted the joint monitoring for the program budget 22-23 in 4 countries in our region. Out of the 8 countries in the world, we are proud that 4 countries came forward to do the joint monitoring in the 22-23. So I request all the member states, we will take forward that joint monitoring for the program budget 24-25 so that we can learn from each other and take forward that experience into the GPW 14 while we plan and move forward. Coming back to the funding and the resource constraints at the country level, it's always based on the implementation. Whatever the resources we have based on the senior management guidance, we support the countries to fulfill the priorities. So that's the mechanism we have. It's very flexible and we are transparent. By country, we have given the implementation, how much it's funded, and we can discuss more when we move forward to the next biennium. With this, I'll hand over to the DPM to add.
Thank you very much, Dr. Tushara. So first of all, we appreciate the progress made in terms of public health progress achievement in our region during 24-25. And we are proud of our contribution to support member states and partners in achieve this progress. As informed by Dr. Tushara, that 24-25 is very challenging in global health financing in many ways: sufficiency, predictability, timeliness, and the management of the volatile situation. We have exercised our best in terms of to promote solidarity in the region, in terms of promote our agility to adjust with volatile situation. You have seen that we have to adjust and readjust again in terms of our implementation planning. The distribution and implementation across budget center, across technical domain, and across between human resource and activity, this is the result of many adjustments. So this is not perfect. So you can see that there's some high and low in some area. Having said that, we are proud of and we will continue the implementing 3 principles. Number 1 is that we will continue to promote our region to be a learning culture for the region. The midterm review report, the evaluation, the joint planning together, we try to continue this practice. Number 2, We are proud of that Southeast Asia region has improved in terms of implementation rate. We are not from the back behind anymore, and we would like to continue. And your guidance to expedite, to close this biennium in a nice way, it is welcome. We will expedite the implementation, although we have many big activity waiting for us and from now to the end of the biennium. But we will try our best on that one. And lastly, the most that we're proud of is we walk the talk, the country first principle. Whatever we have, we try to keep 75% to country office. We try to put 75% to the priority area that prioritized by our member states. And we will continue with that through this transition of GPMU 13 and GPMU 14 as guided by member states. Thank you very much.
Thank you. And any comment from DA? No. Right. Thank you. Let's move. Excellencies, distinguished delegates, let us now take up agenda sub-item 7.2, Program Budget 2026-2027. The Program Budget 2026-2027 marks a significant milestone as the first to be fully aligned with the 14th General Program of Work, that is GPW14, which emphasizes advancing health equity, strengthening health systems resilience, and ensuring sustainable financing. It builds on the foundation of GPW 13 and was shaped through extensive consultations with member states and stakeholders across all levels of the organization. Also, in response to this new reality of a changing global funding landscape, the overall global budget envelope for 2026-2027 was revised from the initial $5.3 billion presented to the Executive Board in February 2025 to $4.2 billion in the current approved version at the 78th World Health Assembly in May 2025. We understand that for an organization like WHO working on the ground in more than 150 countries, and with the mandate and mission that member states have given it, an annual budget of $2.1 billion is very modest. As guided by member states in light of the reduced budget, the organization in the past few weeks was engaged in a major structural realignment exploring cost-saving measures without shrinking its footprint. I am sure that the organization has left no stone unturned in its efforts. I now invite Dr. Katrina Bome, the officer in charge of WHO Regional Office for Southeast Asia, to update our member states the restructuring process held in the Southeast Asia region.
Thank you so much, Mr. Chairman. As you just said, Honorable Minister, the financial outlook for 2026-2027 is, as you all know, challenging. And this required an adjustment to our structure and the restructuring process to happen at headquarters, at the region and in country office. We had a member state briefing on the zero prioritization and realignment with you on the 13th of August 2025, and I just would like to use this opportunity to provide you with a brief update on where we are with it. First of all, let me emphasize that the restructuring was aimed at optimizing our technical expertise, eliminating any duplication that we had, and of course, most importantly, to promote our long-term financial sustainability while maintaining full coherence with the WHO global business model and taking into account gender criteria and geographical diversity. The restructuring is being conducted with a fully consultative, transparent, and fair process. prioritizing country needs, and we've listened to all of you carefully on the country needs and aligned with the member state priorities for the 26-27 program budget. Very much in line with the guidance you've given us also in August. We focused very much on preserving the country office capacity as much as possible. And so the staff reductions at the country level were kept to a minimum, while more substantial cuts had to be made at the regional office. And we used the core country office model as a guidance to ensure minimum viable headcount at every WHO country office, very much in line with the guidance also from headquarters. This was not an easy process, and I'm grateful for the cabinet comprised of all directors and all country office representatives to have worked with me very closely to ensure that the revised structure as much as possible meets the needs of the countries going forward and is as financially sustainable as possible given the situation and in view of the resources available. So let me share a quick update with you on the outcome of the restructuring exercise. So on the 1st of September 2025, the Sierra region had a total of 1,077 positions. And then on the 7th of October 2025, we have now 745 positions retained for the 2026-2027 biennium. Of these retained 745 positions, 245 are in the regional office and 500 in the country offices. So 332 positions have been abolished, which amounts to almost 30% of the WHO CRO positions. Fortunately, many of these positions were vacant, but we had to separate 78 staff members over the last 6 weeks, which, I want to emphasize, and as the Director General has highlighted, was very sad. WHO's key asset is its workforce, and, I want to use this opportunity also again to thank each and every one who has been let go and who has served the organization for many years. So with that, I hope we have followed as much as possible your guidance and your inputs. I want to say in many ways, CRO is best in class, right? I've compared this very much across regions. We have managed for the 26-27 budget to make sure that 75% of our resources have been allocated directly to country offices. So that is almost as high as in the previous biennium. Only 35% of the resources are dedicated to our staff, our workforce, which is a lower amount than for any other region in terms of funding going to workforce and going to headcount, which made sure that we preserve as much as possible the activity budget that we have available to serve all of you. Let me last not least emphasize that, again, that we followed a very solid and thorough process to reduce the workforce over the last month. This process has been documented and communicated clearly. We have the necessary grievance procedures in place, a transparency and fairness committee, for example, and we have ensured accountability and responsiveness to any staff concerns. I now would like to urge all of us, all member states and all partners, to support ourselves mutually in mobilizing the resources needed for our region to fulfill our commitments on the approved PB 26-27 and on GPW 14. The region and our workforce will assure that we will deliver what we promised to all of you, and we will deliver results for GPW 14 through the PB 26-27, and we will do so collaboratively. I would last not least like to invite all member states to please send your planning officers to us for regional consultation with member states in November, 5th and 6th of November, so that we can mature and bring to finalization the very concrete work plans for the coming biennium, which will be very important to make sure we implement against your priorities on time and effectively. I thank you. Back to you, Minister.
Thank you, Dr. Katerina. That was quite a detailed update on the realignment process in the region. I know leadership comes with built-in tensions, like driving results with caring for people and making tough calls while staying true to yourself. However, I am sure that the organization will continue its mandate of serving the member states effectively and efficiently. I now wish to draw the attention of the committee to the working paper which presents an overview of the approved program budget 2026-2027, details of the Southeast Asian region's program budget, update on the Southeast Asia regional operational planning process, and the way forward its implementation. The working paper, along with the SPPDM recommendations and its addendums, is now presented to the 78th session of the WHO Regional Committee for Southeast Asia for its consideration. I now give the floor to the honorable delegates to make their comments and observations on the subject. First, I can see Bangladesh, then Sri Lanka. Okay, I invite Bangladesh.
Honorable Chair, distinguished delegates and excellencies, Bangladesh thanks the Regional Director for the detailed presentation on the program budget 2026-27. We commend WHO's leadership in steering member states through the complex financial environment that we are all experiencing. Excellencies, the approved base segment of the program budget for the Southeast Asia region has been reduced by 14% compared to the previous biennium. For WHO Bangladesh, this translates into a decline from 36.69 million in 2024-25 to $31.73 million for 2026-27. While we recognize the need for global adjustments, these reductions comes at a critical time when member states, including Bangladesh, continue to face mounting health challenges. To respond to this reality, the Ministry of Health and Family Welfare and WHO Bangladesh have worked closely to reprioritize activities and to align with the general program of work, 14 outcomes and outputs. These priorities were agreed upon in September 2024 and reconfirmed during the government WHO Coordination Committee meeting in May 2025. The collaborative process has ensured that our operational plan for 2026 and 27 remains both focused and strategic. Excellencies, WHO Bangladesh has also conducted a critically analysis to preserve essential functions while optimizing at least 25% efficiencies across all areas. Cost-saving measures have already been implemented, including freezing new recruitments, reorganizing office functions, reducing duty travel, minimizing printing, and shifting meetings to government venues wherever possible. These actions demonstrate our commitment to ensuring that every dollar is used effectively for maximum health impact. Looking ahead, Bangladesh and WHO have agreed on several action points to adapt to the reduced budget. First, developing a more focused plan that emphasizes the most critical activities while reducing duplication and encouraging cross-program collaboration. Second, fostering further efficiency through updated guidelines and cost-saving practices. Third, mobilizing resources jointly with WHO through strengthened engagement with development partners and exploration of new financing avenues, including national resources. Honorable Chair, despite the financial constraints, Bangladesh remains steadfast in its commitment to advancing universal health coverage, strengthening health security, and promoting healthier populations. We believe that the strong country-WHO collaboration, efficient use of resources, and sustained partner support, we can continue to achieve meaningful health outcomes for our people. Bangladesh calls upon WHO and development partners to continue supporting member states in navigating this transition so that the momentum toward the 3 billion targets and the sustainable development goals is not compromised. Thank you, Mr. Chair.
Thank you. I now invite Sri Lanka, followed by Nepal.
Thank you, Chair. Sri Lanka appreciates and greatly values its long-standing and productive partnership with the World Health Organization. Over the years, WHO has been a trusted partner to our Ministry of Health, helping us strengthen our health system and advance national health priorities. Our country faces significant demographic and health challenges, including rapid population aging, decline in fertility, and pressure on the health workforce due to out-migration. We must invest in elderly care, promote healthy aging, and ensure every child is nurtured to reach their potential. Additionally, addressing high out-of-pocket health spending, non-communicable diseases, mental health, and malnutrition is essential. Therefore, WHO's technical and operational support is crucial in safeguarding progress and preparing for future health emergencies. Sri Lanka is preparing to launch its National Health and Wellbeing Policy 2026-2035. This policy sets a vision for the next decade, not only to improve health outcomes, but also to enhance well-being across the life course. It places primary health care at the center, with reforms to strengthen financial protection and ensure that every citizen has the opportunity to live healthier, more fulfilling lives. In doing so, we reaffirm our commitment to the health-related SDGs. We welcome the decision to allocate 75% of the program budget for 2026 to 2027 to country offices and 25% to the regional office. This balance rightly places emphasis on country-level delivery, ensuring that resources and technical cooperation flow directly to where they are most needed, within communities, clinics, and hospitals. For Sri Lanka, this approach aligns with our national priorities and ensures that WHO's impact is felt meaningfully at the ground level. We also welcome the commitment to bottom-up, results-based planning. When country needs drive the operational plans, WHO support becomes more effective and impactful. Sri Lanka is committed to work with our fellow member states to make the program budget 2026-27 a success. Together, we can achieve real and lasting improvements in the health and well-being of our people in the Sierra region. Thank you, Chair.
Thank you. Now I invite Nepal, followed by Maldives.
Thank you, Chair. On behalf of the delegation of Nepal, I would like to intervene on the program budget 2026-2027. Nepal welcomes the program budget 2026-2027, the first to be fully aligned with General Program of Work GPW 14. We commend WHO for developing a results-oriented budget that builds on the achievement of GPW 13 and strengthens the organization's commitment to promoting, providing, and protecting health while advancing the Sustainable Development Goals. We particularly appreciate WHO's effort to prepare this budget under challenging global financial conditions. Despite a 9% overall reduction compared to the previous biennium, WHO has safeguarded country-level priorities. In the Southeast Asia region, while the overall decrease is 17.2%, the share of resources allocated to countries has increased to 75% of the base program budget. This demonstrates WHO's strong commitment to ensuring that limited resources are used where they have the greatest impact at the country level. Excellency, for Nepal, we are grateful that the program budget 2026-2027 was developed jointly from the very beginning through close collaboration between the Ministry of Health and Population and WHO. This joint effort ensures that national health priorities are fully reflected and that resources are aligned with the needs of our people. We also acknowledge WHO's proactive engagement in mobilizing additional financing. The strong pipeline of over $113 million for the biennium. Leveraging contributions from philanthropic donors, the private sector, and new financing partners is commendable. We value Member States' support for the increase in the assessed contributions and investment round, which are vital for strengthening the predictability, flexibility, and resilience of WHO financing. Excellencies, looking ahead, we note the GPW 14 results framework with its 15 outcomes and 30 outputs and structured performance tracking through the triple billion indices. We welcome the mainstreaming of equity, gender, human rights, and disability inclusion alongside targeted interventions to accelerate results. For Nepal, operational planning under the new budget will be critical to advance progress toward health-related SDGs and deliver concrete country-level results. In conclusion, the delegation of Nepal expresses its deep appreciation to WHO for its collaborative and transparent approach in developing the program budget 2026-2027 for safeguarding country-level priorities and for ensuring that resources are managed prudently and equitably despite the global financial constraints. Thank you, Chair.
Thank you. Now the floor goes to Maldives, followed by India.
Thank you, Chair. The Maldives commends the Secretariat for its comprehensive presentation of the proposed program budget 26-27, the first aligned with GPW 14. We appreciate the inclusive consultation process that has shaped this budget, ensuring alignment across country, regional, and headquarters priorities despite the financial constraints. We welcome the continued focus on WHO's core functions, country capacity strengthening, and enhanced transparency and accountability. The emphasis on primary health care, universal health coverage, and health emergency preparedness aligns well with the Southeast Asia region priorities. We also value the attention to non-communicable diseases, antimicrobial resistance, and health workforce development critical for resilient health systems. Maldives highlights the need for equitable, sustainable, and context-sensitive funding. Predictable and flexible financing, regular monitoring of measurable results, and active member state engagement are essential to ensure effective resource use. In this regard, we request the Secretariat to explore innovative funding mechanisms, including the strategic use of the newly developed WHO building. Given the recent restructuring of Sierra operations, as highlighted by the officer in charge, this presents an opportunity to generate sustainable revenue for regional activities. We commend WHO's efforts to strengthen its financing model through increased assessed contributions and the launch of its first investment round. Maldives encourages continued expansion of partnerships and resource mobilization across all levels with clear links between financing priorities and results. Chair, we support WHO's commitment to equity, gender, human rights, and disability inclusion. Maldives emphasizes the importance of robust national health information systems capable of generating disaggregated data to guide equitable policy and planning. Strengthening digital health and data systems is vital for informed decision-making, surveillance, and accountability. Finally, we reaffirm our commitment to WHO's leadership in global health and its support for achieving health-related SDGs. Maldives will continue to closely collaborate with the regional and country office to ensure GPW 14 and the program budget 26-27 deliver tangible benefits for our communities. Together, we must strengthen WHO as the global authority in public health, ensuring that it remains well-resourced and capable of fulfilling its mandate under all circumstances. Thank you.
Thank you. And I now invite India to make their comments and observations on program budget.
Thank you, Chair. India takes note of 78th World Health Assembly approved program budget 2026-27 for the Southeast Asia region. Amid financial uncertainties, we commend the WHO Secretariat, the regional office, and the member states for diligent, consultative, and disciplined approach taken to finalize this program budget. The 78th World Health Assembly, through its resolution WHA 78.2, emphasized the need for strict financial and programmatic discipline, recognizing the current global economic constraints. The WHO program budget for 2026-27 fully reflects the strategic vision of 14th General Program of Works, prioritizing equity, resilience, sustainable financing within the health systems. These are the bedrock upon which our collective public health future in Southeast Asia region must be built. Chair, India echoes the recommendations of the Subcommittee on Policy and Program Development and Management that stressed the need to maintain more than 70% of the budget at the country level, ensure equity and resource allocation, enhance capacity building and technical cooperation, and strengthen monitoring and evaluation of fund utilization. We believe that while the enhanced financial support to global technical centers is a welcome step, it should not come at the cost of WHO's support to its regional and country offices. Chair, India appreciates the regional office for maintaining its core principle of member state-driven delivery. The allocation of more than 75% of the budget to country offices demonstrates a clear commitment of country-first approach, whereby the impact of WHO's technical cooperation and capacity building efforts will directly impact and strengthen systems and improve lives. We also note with concern the 14% decrease in the regional base segment compared to the 2024-2025 biennium. While the fiscal realities demand prudence, it is crucial that essential country-level activities, particularly those related to primary healthcare, non-communicable diseases, health workforce development, and emergency preparedness, remain adequately supported. Chair, India supports the twin-track approach, which entails the systematic integration of gender equality, equity, human rights, and disability inclusion across all interventions, along with targeted measures to accelerate progress in these critical areas. India looks forward to upcoming member state consultations on operational planning for the program budget 2026-27, which are expected to advance progress towards health-related sustainable development goals. Thank you.
Thank you. I now invite the delegate of Democratic People's Republic of Korea and then Thailand.
Thank you, Chair. The program budget 2026-2027 is the first period of GPW 14 2025-2028, which prioritizes health equity and health system strengthening. However, as the budget is reduced, reprioritization has been undertaken among all member states, and DPR Korea has also attended this reprioritization and agreed to equity in access to quality services, health workforce strengthening, management of risk factors, and preparedness and readiness of health emergencies as high priority. In order to accomplish the goals set by WHO with limited funds, it is important to keep country-centered and country-prioritized principles, which enables WHO's support and cooperation to substantially reach primary health care level for the improvement of people's health and well-being. For this, though the financial condition is getting worse, we would like to recommend the regional office to strengthen the monitoring and evaluation of the fund allocation and its utilization, as well as to improve the equity, transparency, objectiveness, openness, and accountability in the financial management. Thank you very much.
Thank you. Then I invite Thailand.
Thank you, Chair. Thailand commends the Secretariat for the preparation of the proposed program budget 2026 to 2027, the first to be fully aligned with the GPW14. We welcome its strong focus on equity, resilience, and measurable country impact, which reflects our region's shared vision on health for all by all. The proposed budget demonstrates fiscal realism and strategic discipline, ensuring continuity of essential functions while adapting to the evolving global context. We appreciate the WHO's consultative and transparent approach, engaging member states to identify priority areas that addressing pressing health needs, including primary health care, communicable and non-communicable diseases, health workforce, financing, and emergency preparedness. Thailand values the strengthened results framework of 18 outcomes and 42 outputs, which improves accountability and alignment between global and regional priorities. We also commend the integration of gender equality, equity, and disability inclusion as cross-cutting dimensions throughout the program budget. At the regional level, Thailand welcomes the continued country-first approach, maintaining more than 70% of resources at country offices, where implementation delivers the most impact. We further support the WHO's efforts to achieve predictable and flexible financing through the investment round and increase assets contributions, essential to sustain long-term results. Share Thailand reaffirms its support for this program budget and encourages ongoing dialogue to ensure that every investment in health delivers measurable, equitable, and lasting impact for all. Thank you, Chair.
Thank you. Thank you all the delegates for your comments and observations on the item 7.1 and 7.2, that is the program budget 2024-2025 and the program budget 2026-2027. And any observations and comments from the Secretariat?
Thank you, Chair. Excellencies, distinguished delegates from the member states, I want to really appreciate your support in developing this program budget. As you all can remember, it was last July we started the prioritization. We prioritized, we presented, then again we asked you all to revalidate. You were so kind enough, you came within a month with our country officers with your revalidation to address our resource constraints for the 26-27. Now we are with the challenge of delivering more with less. We know that the budget is decreased, but with the senior management guidance, with all the consultation, we know that we had to reduce our budget because of the Indonesia moving into the WIPRO region. Despite that, we could allocate 75% of the budget to the country officers. If you all can remember, if you see 2018-19 budget, it was only 65% at the country level. With all these constraints, today we have reached 75% budget at the country level. So this itself an achievement. And as Dr. Katrina highlighted, we are efficient as a region on human resources. We always keep around 36 to 40% maximum. And it's very important that this collaborative approach moves toward the results. When we start the GPW 13, we all can remember that we had the indicators at the output level, outcome level, and the impact level at the 3 billion target. Now the results-based management we have got into our system, so it's very important that we follow that. And you all have supported us in baseline in the output indicators for the 26-27, and in upcoming meeting we will discuss more and the prioritization. And with the prioritization, that the specific interventions with the country support effort from the regional office and the HQ, we know that we can achieve the results we have agreed under the GPW 14. And it's nice to hear that we all are committed to gender equity rights and the disability inclusion. It's an area we can discuss more so that all our programs is inclusive and then we can really reach the disadvantaged population and march towards achieving the SDGs at the country level. So in the upcoming meeting, your recommendations you have given today, as well as the recommendations we have at the SPPDM meeting, we will move forward with those, and we look forward to the meeting on 5th and 6th November to discuss in depth with the country planning focal points, the Ministry of Health planning focal points, our technical colleagues, and the senior management. We all get together 2 days so that we can discuss what are the regional priorities we are going to address and what type of support you all needed from the WHO, all 3 levels. So that's the idea of that meeting. And we look forward to what we have planned and refining them more. At the same time, as you all have highlighted, it's transparency, accountability, and mobilizing the resources need. So if we have good plans, we can move forward and mobilize the resources and be more efficient. With this, I'll hand over to DPM.
Yes, DPM, anything else to comment?
Thank you, Chair. Thank you, Dr. Tushar. WHO is member state agency. Without member state, we are nothing. But to be sustainable in the long run with less budget, so we need to adjust. And then, as Dr. Katrina informed you, that we have we plan and we have done our best in terms of how we can survive to do the function, not just survive. Survive to meet the expectation, to fit with purpose that our member state guide us. For program budget 26-27, this is the first program budget fully under GPW 14, and we will try our best in terms of how we can execute the expectation, the requests from our member state, including in many resolutions, many decisions, many declarations given to us by our governing body. We need to change the way we do in very efficient way. As you said, that in terms of we have to reconsider how we conduct the meeting, we do the travel, duty travel, how we do the cross department, cross office collaboration, how we be more transparent and held accountable on how we not everyone doing everything, but we through strategic selection of the function that need to be conducted at country office, at regional office level, and what headquarters will do. So that is about more help for dollars. But we also need more dollars for health. We start program budget 26-27 with quite a substantive funding gap. So that is a reality. That is a reality for all of us here. So we appreciate and we thank very much in terms of member state in our region that agree for the sustainability financing plan, financing at the global level. Without your commitment many years ago and commitment to implement, with in particularly the increase of AC assess contribution, we should be in the perhaps very much worse situation. But in terms of this sustainable financing resolution, this is not only about the sufficient or dollars that we have, but in terms of predictability and ability to manage the function and activity fit to our expectation. But we need your support in terms of further resource mobilization as guided by Maldives, that we need both innovative and more and normal way of financing. We need both traditional partner, we need a new potential partner who can support with us and change the way we work for. We also need more dollar for health as well. And lastly, it's our pride that we continue our country first. We would like to, in our program budget 26-27, we start hearing from you since August 2024 in terms of prioritization. And again, we verify it with your output on March 2025 on this area. And we are proud of that majority of our funding go to the top 7 outcome, be it primary health care, human resource for health, NCD, risk factor, preparedness. So we should be fit for purpose, but we request, number 1, bottom-up, we continue bottom-up planning. Second, we will continue participatory joint planning. And number 3, we do result-based planning to our program budget 26-27, and we welcome your engagement for our the detailed planning that happened in 5th and 6th November. Thank you very much.
Yes, Katarina.
So thank you so much to all of you also for highlighting your financial gaps. And I just want to emphasize in one sentence that we are acutely aware of the worries many of you have in terms of the gaps left by USAID withdrawal, by by Gavi perhaps not being able to commit as much as they have been in the past, by Global Fund perhaps leaving gaps as they have not done in the past. So yes, it's time to step up domestic resourcing, but I also want to say we're very much committed to working with you on more innovative ways of financing, as the Maldives have highlighted. And want to say that I'm very grateful here also to all the partners who are here. I see several development banks in the room. I see many partners, also civil society partners, who themselves have been hit hard by this financial crisis, and grateful that they stand steadfast with us on this journey and on fundraising with us also going forward to fill the country gap, because that's also what Dr. Tedros has always highlighted. Our priority is not to meet our WHO needs as a workforce, but to meet your needs and the financial gaps left in your countries. Thank you.
Thank you, the Senior Management Secretariat of the WHO. Then we are moving to the agenda item 13. Before the lunch, Excellencies and distinguished delegates, let us now take up agenda item 13, time and place of future sessions of the Regional Committee. The committee each year decides on the time and place of the following year's meeting of the Regional Committee. I now call for propositions from the distinguished delegates to host the upcoming sessions of the Regional Committee. The committee look forward to your gracious offers to host the session in line with traditional practice. I now give the floor to member states. I see Thailand. No, right. Anyone else? Maldives? Yes.
Timor-Leste.
Right. Timor-Leste first.
Thank you, Chair. Excellencies, Head of Delegations, distinguished delegates, ladies and gentlemen, colleagues and friends. As we look ahead, it gives us great pride and joy to share that 79th session of the WHO Regional Committee for Southeast Asia will be held in Timor-Leste. This will be a moment of great pride for our nation, a young and a vibrant country standing at the heart of the Southeast Asia region, where the first rays of the sun greet our region each morning. Timor-Leste, the land of the rising sun, blends breathtaking natural beauty and a rich cultural heritage, and the people whose warm hospitality are unmatched. It will be more than a decade since we last had the honor of hosting the Regional Committee. This return marks not only our nation's progress, but also our shared journey of solidarity, resilience, and the commitment of health for all. In 2026, we look forward to welcome all member states who WHO leadership and partners to our source to deliberate, celebrate, and strengthen our collective resolve to advance universal health coverage and well-being across the region. On behalf of the Excellency Dr. Elia Duzreis Amaral, Minister of Health, and the people of Timor-Leste, we extend our warmest invitation to all of the member states to join us for this historic gathering. We assure you of our full commitment to making the 79th session of the Regional Committee a memorable, meaningful, and a truly enriching experience. Come, discover Timor-Leste, where the mountains meet the sea, where a tradition meets transformation, and where every sunrise reminds us of new beginnings. We can't wait to welcome you all to Timor-Leste in 2026. Thank you, Chair.
Do you have it? Yeah, yes.
Insan, a young and vibrant nation in Southeast Asia, full of beauty and resilience. Nestled between Indonesia and Australia, Timor-Leste offers breathtaking mountains, lush valleys, and pristine beaches that remain untouched by time. Beneath the waves, some of the world's most various coral reefs invite divers and adventurers from across the globe. The nation's culture is alive in traditional dances, colorful ties weaving, and the music of its people, warm, welcoming, and proud of their heritage. After years of struggle, Timor-Leste gained independence in 2002. Today, it stands as one of the world's newest nations, looking forward with courage and hope. Visitors are invited to experience the harmony of nature and tradition, from sunrise over Mount Ramelau to the hospitality of rural villages and the vibrant spirit of its capital, Dili. Timor-Leste is investing in health, education, sustainability, and tourism, shaping a brighter future for generations to come. Welcome to Timor-Leste, the land of the rising sun.
Then I invite Maldives.
Thank you, Mr. Chair, Honorable Ministers, distinguished delegates. Allow me to begin by expressing our sincere appreciation to the Democratic Socialist Republic of Sri Lanka and to the WHO Secretariat for the excellent arrangements and warm hospitality extended to all delegates during this session. Building on our successful experience in hosting the 70th session of WHO Southeast Asia Regional Committee in 2017, the government of the Maldives would be deeply honored to host the 80th session of the Regional Committee in Maldives, in Malé. We stand fully committed to fulfilling all hosting responsibilities and to working closely with the Regional Director and the Secretariat to ensure the highest standards of organization, security, and technical support. Our goal is to provide a productive, inclusive, and memorable meeting for all member states. We prepared
we prepared a brief presentation outlining our past hosting experience, followed by a short video showcasing what awaits you all in 2027 in the Maldives. Mr. Chair, we respectfully invite the committee to consider and endorse our offer to host the 80th session of the WHO Southeast Asia Regional Committee in Male, Maldives, in 2027. Thank you.
Thank you. Now we'll see the video.
This slide. Just to give you a brief history of our previous experiences in hosting the RC in the Maldives. So we're an island nation with around 350 population, consisting of almost 200 inhabited islands. Next. So in the past, we have hosted RC a few times, and most recently in 2017 as our DG's first RC for Sierra region. So it has been quite an experience for most of our delegates and also for the Secretariat to have been hosted. And our minister was also the host during the last RC at Maldives. Next, please. This, please. See you in the Maldives in 2027.
2027, right. Thank you, and thank you your proposals. I understand that the Secretariat will incorporate your kind offers into a statutory decision on this agenda. May I now invite the Secretariat to please read the draft decision.
Thank you, Chair. Time and place of future session of the Regional Committee. The committee welcomed with appreciation the invitation of Government of Democratic Republic of Timor-Leste and decided to hold its 79th session in Timor-Leste from 7th to 10th September 2026. The committee also welcomed with appreciation the invitation from the Government of Republic of Maldives to host its 80th session in 2027 in Maldives. Should any unforeseen limitations preclude the holding of the original committee session in Timor-Leste in September 2026, adjustments to the modalities, venue, and dates should be made by the chairperson and/or the vice chairpersons of the regional committee in consultation with the regional director. Thank you.
Thank you. Distinguished delegates, any comment or observation to the draft decision? No? Good. With this, the decision is hereby adopted. Thank you. Excellencies and distinguished delegates, that brings us to the close of our morning session. Before we disperse for lunch, I hand over the floor to the Secretariat for announcements, if any.
Thank you, Chair. Just to remind you that resolution drafting group will start during the lunchtime from 1 p.m. onwards. Also, please note that we will have a side event that is starting right away. This is Malaria Marathon, the ultimate race to zero malaria in Southeast Asia. And this is hosted by Timor-Leste, and it will start right away after this session. Thank you.
Thank you. The meeting is now adjourned. We shall join back after lunch, 2 p.m., to resume our deliberations on other agenda items.